Good morning. And for those online and those who are here in person, a huge thanks for you taking the better part of your day to contribute to what I think is a growing, expanding, and very important initiative. So I would ask a couple questions, kind of Socratic methods. So um, the College of Veterinary Medicine and their programs have been at WSU for a long time. Guesses on how old the vet programs are at WSU? How many years old? Shout it out. Let's go here in person, maybe I would ask. How old is veterinary medicine? Okay, so I hear 100 years. Okay, we could vote on that. Actually, Doug, more like 120 years old. Now let's play the game again. How old is the pharmacy program at WSU? 127. Thank you. So someone said, give or take a few years, 126 years old. So it's about 125 to 130 years old, depending upon how you measure it. So what does it really speak to? WSU has been committed for over 100 years to the education, the health of Washingtonians. We're committed in ways that we do our education, we do our research. We are also committed in our outreach and connection. So I would ask, how many agreements do we have across the state that involve our health organizations? Let me just help you out. Between 500 and 1,000 agreements across the state. We're in all 39 counties. So we welcome you to this campus, which serves as the headquarters kind of for our College of Medicine, our College of Pharmacy and Pharmaceutical Sciences, and also our College of Nursing. But we're a distributed system. We, as I said, are in every county. What does that provide? An opportunity for us to partner, not only internally, where we partner with each other, but partner with organizations that have a common or overlapping mission. We're very pleased to have leadership from the State Department of Health here. We have leadership from federal organizations on campus today too, representing the way that WSU approaches our mission and our vision, partnerships and commitment to working together to address real challenges and bring solutions. So I would say thank you very much for being here. Many would ask, where is Vice President Kerr? Well, Vice President Kerr is in transit. And I think that Colleen would say that for the next pandemic, we want to be on speed dial with our state organizations. And because we bring some answers that will help them to address some of their biggest concerns. So one of the things that came out of the pandemic is a need for us to connect more internally and then connect externally. With a growing health sciences enterprise in the research space, doing much in the way of community and population health, we fit very well with the mission of the State Department and with public health. So here's what I would ask of you today. Please be very deliberate to identify others who you could work with. Foster those relationships that are already in place. Have some of those dynamic conversations that lead to action, whether that's to submit grant proposals together, to initiate research, or to expand our educational footprint. I'm asking for those in nursing, pharmacy, medicine to work with each other. I'm asking for those in CAS, in CVM, in Murrow to work with each other, to think about what we can do to address some of these problems. So I'm super excited that you would be here. I thank you for your time. I know that folks have come from the state. This is a who's who of leadership for our institution, and I really appreciate that you're here. I'm going to turn this over to Celestina, but I think that Colleen would like to say she is very excited. She will probably address you, but she's super excited about the energy, the way that we are working together, and the fact that we are moving into more of a mature kind of a health sciences to really help the state in a different way. So we've been here for a long time. We are committed to our land grant mission. We are all across the state. We are a network across the state. So it's a pleasure for me to partner with multiple groups internally, including the EAGER team. But I'm going to turn it over to Celestina Barbosa-Leiker. I need to step back upstairs to meet with some other folks, but I'll be in and out through the day. It's just exciting to have you here. Thank you very much.
Thanks so much, Daryl. Welcome, everyone. I'm Celestina Barbosa-Leiker, Executive Vice Chancellor here at WSU Health Sciences Spokane. Welcome to the WSU Rural Remote and Underserved Public Health Research Symposium. We have had over 150 folks register for this event. Many are over Zoom, so welcome. Thank you all for attending here. And come on in. Come on in. We're going to keep this day really flexible for everyone. I first want to introduce some guests that we have here today that are very eager to learn about WSU's public health research. So please join me in welcoming from the Washington State Department of Health, Dr. Tao Kwan-Get, Chief Science Officer. Is he present?
With Dr. Record.
He is upstairs. Yep, he's with Dr. Record. Okay, with Interim Dean Record from Medicine. Okay. David Bain. I saw, yep, hi, thanks, David. Yep, Deputy Secretary for Strategic Partnerships, and Carrie Evans, Academic Affairs Director. Thank you so much for joining us today. We also welcome Jeff Ketchel, Executive Director from the Washington State Public Health Association. He might be over Zoom, I'm not sure, or coming. And we also have guests here that are not officially external guests because they have a WSU affiliation. So if you see some friends and colleagues that have a WSU affiliation from across the state, we are very excited to connect with you today. As many of you know, last July, members of the WSU COVID-19 Scientific Advisory Subcommittee, or as we know it as SAS, came together in Pullman to discuss the ongoing evolution of the public health collaboratives and initiatives that we have across our university. And we wanted to figure out how to best engage community stakeholders and leverage internal and external collaborations. And this symposium today is the next step. So we've started today with 6 talks on various public health research topics. We could have chosen 6 completely different topics. So we are not trying to capture everything that we do with public health research today. We just chose these 6. So please don't feel dismayed if your area of public health research isn't highlighted today. And please look for an email from me in the future asking for volunteers to give a talk about their public health research so that we can highlight all the great stuff that we're doing here. Before we begin, I want to outline the structure for today's program. So as you can see, we have both in-person and remote participants, and the layout is as follows. Each presenter is going to give a presentation for about 20 minutes, and then we have a 15-minute either Q&A here in the room, dialogue, or a networking break. I'm trying to keep the day here really flexible and really just see what's needed here as we go through each presentation. So we'll first open it up to questions over Zoom. So we have a Zoom moderator for each presenter, and we'll introduce them as they go. And so Zoom participants can go ahead and put any comments or questions in the chat. When the presenters finish with their talk, they'll kick it over to their Zoom moderator. We'll start with them. We'll open it up to the room, take a break as needed, allow time for networking and just connecting with one another, or just use the time for a full group discussion, whatever works best. Let's see, we're being recorded over Zoom. And closed captioning is available for those in the room. Just log into Zoom if you'd like the closed captioning. We're not doing it live here in the room. So we ask that everyone silence their phones, and Zoom participants, please mute yourself. And during the formal presentations, please turn off your camera. So with that, with the logistics then taken care of, the goals for today: increased understanding of the breadth and scope of WSU research being done within public health. So please note, our presenters today graciously volunteered with minimal grumbling, at least to me. They might have grumbled to all of their colleagues to talk today. They were all very concerned, though, that they weren't going to be able to capture all of the research in that area. I assured them that that was okay. We were a friendly audience here, and that would be with the Q&A and the dialogue and the networking breaks were here. So if you are doing research in one of these areas and you're not highlighted, let's just have that discussion and we'll continue to build the bridges. That's the whole point for today. We'll also identify others across the university system that share interest in public health topics. We want to look at our assets, but also our gaps in research so that we can help let the other offices know exactly what we need to grow our public health research here at WSU. And then we want to then end with ways to effectively engage with the WSU Public Health Collaborative effort moving forward. So that's what we'll ask all of you towards the end here. So with that, I'd like to welcome Dr. Naomi Bender, Director of Native American Health Sciences, to offer the land acknowledgement.
Thank you, Celestina. Thank you, Celestina. Napakayaki, Kitusimi, Haikoikoi. My name is Naomi Bender. Welcome for the day. And I'm just so glad to see so many faces and be in a real place in real time with everyone. I'm going to ask everybody to stand if you would. We're going to be sitting a lot today. I believe in movement. And before I read the land acknowledgement, I would like you, this is a good way to start the morning. I want you to reach across the aisles, kind of like you do at church and other settings. And I want you to greet people next to you, behind you, introduce yourself to others next to you. I'm going to give you a minute to do that. Hi. Say good morning, introduce yourself. Okay. Thank you for doing so. I know. I'm letting the cats loose. I'm gonna herd you all back in now. I know. All right, everybody. I'm gonna start whistling. All right, everyone. Can I get your attention? Fun exercise. I'm gonna ask you to stay standing, and always a fun activity because it allows me to see from this point of view community engagement, smiles, and having people see each other they haven't seen before, or recognizing colleagues and their work. And that's purposeful this morning. I apologize for those of you who are online. I hope that you're able to do so in some capacity through chat, so I hope you can reach out that way as well. Land acknowledgements are important. I'm going to read this and then I have a quick follow-up. We acknowledge the land in which WSU Health Sciences Spokane sits and occupies as the traditional homelands of the Spokane tribe of Indians. Without them and their continued sacrifices, we would not be able to conduct our work or have this place or dialogue. We take the opportunity to humbly thank the original caretakers of this sacred land and the lands of which each one of us here today occupy and call home, meaning anywhere you are in Washington, Idaho, Montana, wherever you come from, recognizing the traditional homelands of the people who were caretakers long before we came. Now, I bring this up about you all hugging and having a conversation because I'm going to read a couple inserts that the traditional historian of the Spokane Tribe of Indians offered our new Center for Native American Health in a beautiful mural that recognizes where we're at and what WSU is doing to commit to serving people. They state, "Welcome to the homeland of our people, the Spokane Tribe of Indians, where these buildings sit, and for the 3 million acres that lay along the banks of the Spokane and Columbia rivers and south to the prairies, were all the lands Spokane's did 80% of their hunting, fishing, gathering for thousands of years." A quote from an elder from 200 years ago. "It was beautiful then with thousands coming from many miles. You could hear the shouting welcomes as they arrived, the dancing, the singing, the trading, the games, the races always, the heart hugs, and the fish. The fish sometimes so thick it seemed like they filled our waters." My grandfather used to tell me how it was right below where we were standing. Indians from all over gathered every year for the annual salmon fishery. My point in sharing these quotes is that we are all gathering in a space where for thousands of years, people before us have gathered to trade ideas, to trade goods, to trade food, to trade care and medicines. And fast forward in today modern society, we have a civic duty as people and not just institutional partners and employees. But when we read land recognitions, to really contribute to that land recognition, saying, what are we doing? What's my part to this land? What is my part to the people I serve? And part of that understanding and humanity is reaching out. So I want to thank you for participating in my small little exercise, but I hope it helps bring some sort of joy and connection to what you're all doing here today. I want to thank each one of you for being here and honoring the work that needs to move forward in order to serve our people in better ways. Thank you.
Thank you very much, Naomi. That was powerful. And thank you for helping to center us as we start our day here. Our first presenter then up first, talking about substance use disorders. I'll let him give his full introduction here is Dr. John Roll. John will be co-presenting with Dr. Jessica Willoughby, who's over Zoom, and she will also be serving as a Zoom moderator. Thanks.
Thanks. The slides are just next. Okay. Well, let me get set up here. In case some of you say something profound, I want to be sure I can write it down. Get my own timer going. Right. Thank you, everybody. It's a pleasure to be here today. I do, as Celestina said, Jessica, Dr. Willoughby, has agreed to co-present this with me. She's managing things on Zoom, and I'm really honored to be here with her. We have the somewhat daunting task of trying to describe in 20 minutes the breadth of substance use work that's happening across the WSU system. That's hard. A quick PubMed search will show recent articles from every single college in the university in this area, every campus. At any given time, we will have over several $1 million of federal funding, and each year there's dozens to hundreds of articles published on this. So you know we're not going to hit everything. So apologies a priori to those who I leave out. We've sort of selected the data, the presentations I'm going to show based on a public health focus. But if I were going to have some co-presenters, those would be some of them. I did that pretty quick, so if you couldn't find yourself in there, if I left you out, just to make the point that there's lots of people working in this space. Now, today we're going to use this rubric to guide our thinking. I think if I use this mouse on Zoom, you can see the cursor. So I'll try to do that. What I first want to talk about is continuum, if you will, from foundational through translational to applied work in this area. I'm going to do that by just showing you the titles of several articles that run that gamut. I want to make the point, as this metric says, that there's no hard boundary between these. What's applied and what's foundational. There can be some blurring at the edges there, and that's a good thing, I would say. So let me just hop into this. Here's some clearly foundational work, work by Michael Morgan at the Vancouver campus on pain and opioids, work by Rita Fuchs in Pullman, looking at optogenetic inhibition of the dorsal hippocampus, CA3 region, very foundational work. Still foundational, but getting a little bit more applied. We have work by Carrie, Michael, Rebecca, Alexandra, looking at short and long-term effects of cannabis on headaches. Terrific work from our criminal justice team, looking at validating drug court collaboration assessments. Susan Collins recently published a great article in the Lancet, looking at combining behavioral harm reduction treatment and extended release naltrexone. Still in the basic applied realm there, we have work by Celestina, who just spoke, where she's a leading expert on opioid use disorder in women and the implications for treatment. A study by Jessica looking at social influences, perceived customization of messages on social messaging. And then finally, really pretty highly applied work, investigating the efficacy of a self-directed parenting intervention to reduce risky behaviors by Doctors Hill and Road or Cooper, use of cell phones and computers for health promotion and tobacco cessation by American Indian college students in Montana. And finally, borderline personality disorder features and risk for prescription opioid misuse by Sarah Tergesser from our Tri-Cities campus. So what I hope that showed you is just we have this whole breadth of expertise here at WSU. What I didn't, I'm sorry, folks on Zoom, I keep pointing with my fingers. What I didn't really talk about here was translational work. So I want to give you just a couple of quick examples there as well. I have some actual data slides here, but the time we have allotted to us today won't allow me to go into any detail on those. There's two types of translation in my mind. The normal one we think of is kind of a microscope to a bedside. And I'll show you an example of that. We're lucky at WSU to have Dr. Philip Lazarus as a colleague in the College of Pharmacy. He is one of the nation's leading translational scientists in pharmacogenetics and substance use disorders. He does lots of things. Today, I'm only going to talk about his nicotine work. He and his colleagues have identified important enzymes in the metabolism of nicotine. They've demonstrated genetic variation. And finally, they've developed novel agents that can help reduce levels of smoking. So there you go, from enzymes to new putative pharmacotherapies. And I'll tell you what, these pharmacotherapies are probably just about as valuable as cosmic crisp apples. If you develop a drug that's going to help treat smoking, you hit the jackpot. So that's one way, microscope to bedside. But we can also go the other way, and this is important to recognize. So here we have an example from the labs of Carrie Cutler and Ryan McLaughlin, our friends in Pullman. This was a study Carrie did looking at blunted stress reactivity in chronic cannabis users. You can see what she found there. Again, I'm sorry, I don't have time to go into the details, but what they did with Nicholas Goldowski, their student, is they back translated that. So they took this real world observation and took it into the rodent laboratory where they could tear it apart and parse it and a little bit better understand it. So we have people doing translation in both directions. I'm going to show you one last example of translational research. Pardon me. I think it's the most mature example in this realm at WSU. And with apologies to everybody else, it's from my group. So we do a lot of work on an intervention known as contingency management, which is one of the most effective behavioral interventions there is, if not the most, for addressing psychostimulant use disorder. And we do a lot of these, what we call analog trials. Here's one example where we looked at reinforcer magnitude and reinforcer delay. You could do these in animals. This one's done with humans in a kind of a behavioral pharmacology analog space. Again, no details, but then we take that and we apply it to a real clinical trial. Here, we could have picked from 24 clinical trials. Here's one that Mike McDonald was the lead on, looking at using our intervention contingency management for psychostimulant use in community mental health outpatients with co-occurring serious mental disorders or illness, a real challenging population. And you can see the blue bars there, again, sorry folks, I'm pointing. The blue dots on here represent the interventional phase over 3 months, 4 months. And you can see that throughout our intervention provided more abstinence, if you will. So it's really quite successful. And now we're taking this intervention and disseminating it throughout the world. In the United States, everywhere there's a blue star on that map, we are being paid to disseminate this intervention and to train people on how to use it. This is largely under the direction of Dr. Mike McDonald, but with the great help of Drs. Parent and Peavy, who are pictured here. We also, Mike is just finishing up some work in Uganda, and Sterling McPherson and Andre Miguel are just finishing up some exciting work. Well, they're really finishing up. It's ongoing in Sao Paulo in this area. So there we go. Really foundational, translational to truly applied, disseminated work. Next, I'd like to focus on the gray arcs of this circle. Again, just using titles of manuscripts to give examples of what we're doing in this space. For epidemiology, again, we have lots of work in epi. And it's hard to pick out one. Here's one, spatial epidemiology by Ofer. You can all read the title there. Social determinants of health, we could have picked from hundreds of articles. Here's one that we sort of selected for the relevance to today's topic. Modeling we're pretty good at this clinical epidemiology or longitudinal modeling. What we're not good at is agent-based modeling. We don't do much of that. Perhaps Dr. Lofgren's going to talk about some agent-based modeling in his talk. I don't know. Our colleague Elisa Schwartz and I have had many conversations about how we could do more sophisticated modeling, and we've even met with Los Alamos National Labs to talk about it using their computer resources to do that. And I think that would be fun to do. I mentioned that we are disseminating that contingency management intervention widely. We're also contributing to the scholarship of this. There's an article by Dooney, who's in the back there. Hi, Dooney. Public health communications out of Murrow, extraordinary group of scholars. And we have an article here by Jessica that illustrates that. Economics, it's super important in my mind to do these health economic assessments of clinical interventions if you want to disseminate them into the real world. Here's just one example. I've added two additional things that weren't in those ARCs. One is policy. We also do a lot of straight up old school policy analysis. Here's one: Medicare prescription drug plan coverage of pharmacotherapies for opioid and alcohol dependence in Washington. And then methodology. I'm not going to talk about the foundational science laboratory-based innovations. There's lots of those as well. I'm only going to talk about the innovations that really have public health significance. First of all, we have people like Eka, who's sitting right next to Dooney, developing novel trial protocols and publishing about those. This is great. In substance use research, there's often a lot of missing data because substance users tend to come in and out of treatment. And that's important data. The absence of those data is important. And here's an article Sterling contributed to as lead author on a data justice-based approach. Sterling, I won't make him wave, but he looks kind of grumpy back there in the corner. Sterling is one of the nation's leading experts on how to handle missing data, probably because he's worked with me a long time and I don't have lots of data. And then finally, we have teams, Celestina, who you heard from earlier, is a psychometrician who does excellent work kind of refining commonly used psychometric instruments, in this case, the clinical opioid withdrawal scale, to increase their sensitivity for use in real world settings. Now, land grant mission and extension. This is a fun story to tell, and I really wish Glenda were here to hear it because it starts. Oh, hey.
Which grant?
When did you sneak in?
Just like I did in class.
We have the CROPTER, the Center for Rural Opioid Prevention, Treatment, and Recovery. And I'll tell you how this started. But first, I want to acknowledge where it came from in part. We received the only center grant from Life Sciences Discovery Fund east of the Cascades at WSU, the Rural Mental Health and Substance Abuse Treatment Program, which really sought to bring science to bear on substance use and mental health issues in rural and urban areas throughout the state. One day, here's the story. One day I was sitting at my desk, probably wondering how long till I could go home. And I got an email from Glenda or a text or something saying, can we apply for this? And it was a ROTA grant, Rural Opioid Technical Assistance. And I said, it'd be cool if we could, but it turned out we couldn't, but we were perfect for it. So with the eager team and Glenda, the former Dean of Ag, and I and Scott Hulbert made a trip back to DC. Linda and the great group at Cornerstone squired us around, and we were able to convince important stakeholders to open up the opportunity, not to give us the money, just to allow us to compete for the money. They did that actually very quickly. And then we had to recruit some PIs to write the grant, and Dr. Waybright, who's here in the front row, second row, and Dr. McDonald stepped up and agreed to do that. So we wrote the grant, got it, turned out to be great. You can see it goes through 23. We should be hearing about a competing renewal any day now. The real purpose is to develop and disseminate training and technical assistance to rural communities using the extension framework, the trusted, long-established relationships that exist there, and to build capacity in those communities. We could spend 3 days talking about everything I've talked about so far, and at least one day on this. So I'm sorry, I have to flash through this. Some of it is we have these on-demand trainings. You can just click in there and get them anywhere. There's live trainings. There's lots of different things. And you can see the breadth of training that's available. something I love is we often involve youth. This is really through Elizabeth's team. These two young people from Yakima made these posters, and it really involves youth in these activities, and I think that's great. When I see this picture, I'm sorry they're wearing masks because I guarantee you they'd be smiling under there. What are some of the WSU resources to support this type of research? We've got a lot going on in this area. First, we have ADARP, the Alcohol and Drug Abuse Research Program, directed by Rita Fuchs, and a new program specialist, Teresa Landrum, who replaced our longtime friend, Jenny Balon. ADARP does lots of things. In my mind, the most important thing they do is provide pilot funding. Many of those studies, I just showed you probably 30, 40 studies, many of those started with ADARP pilot funds. We also have PAIR, the Program of Excellence in Addictions Research, which I started about 20 years ago now with $1 million federal earmark. And here's a slide from Sterling, who is now the director. In the last 15 years, this is a little dated, that group had attracted over $50 million in research funding and published over 200 articles. Sterling and Rita work pretty closely hand in hand to facilitate interactions between the more applied group here and the more basic foundational scientists represented by ADARP. And in fact, I'm going to be giving this essentially the same talk, hopefully a little slower, to a joint meeting of those groups soon. We also have the Murrow Center for Media and Health Promotion Research. Sometimes I don't think this center gets enough credit. It's one thing to develop things, but it's important about how we talk about them, how we convey that message. And this center, the folks in there can do this better than anybody in the world. We have the Impact Research Lab, where they're really designing and implementing prevention techniques. You can see some of our friends in the audience here in this photo. We also have CC Pro, the Center for Cannabis Policy, Research and Outreach. This group doesn't just focus on substance use issues related to cannabis. It works on the putative therapeutic effects of cannabis and cannabinoids. I guess I shouldn't say putative at this time. There are some that are well documented. Looking at public policy, safety, economics, and especially agricultural research. I'm not going to highlight individual labs, but I want to call out two. First is Apple, the Analytics and Psychopharmacology Laboratory, run by Sterling McPherson. This is where most of our cutting edge clinical trials of putative pharmacotherapies for substance use happen. A couple R01s right there, right now looking at zonisamide and varenicline. And then PRISM, I see a number of members of PRISM here. This is the place in my mind where the mental health research and the substance use research come closest together, and that's an important intersectionality. Also, Sterling and Mike pay for, out of their own grants, they have a clinic downtown here in Spokane. It's a great resource where a lot of clinical trial work happens. We also have iReach, of course. Dr. Whitney's here. He's the director of the Health Equity Research Center. This can play a big role here. Later today, we'll hear from Dr. Johansson about Northwest Heron, our practice-based research network, and our Sleep and Performance Research Center on campus is now doing old school behavioral pharmacology to look at effects of commonly used drugs on performance issues like driving. Okay, remember I was told to talk about these points in this order. So value to the state. Lots of different ways I think we can capture this. One is in companies started. Here's a company started by Susan Collins to make harm reduction treatment resources available to clinicians. Here's one started by Sterling and Mike McDonald and others, Managed Health Connections, to facilitate the interface between those who provide care and those who receive care. Some of the most impressive work I think right now is some that Dr. Berduli is helping with on managing neonatal abstinence. We're also part of Region 10 of HHS. Here's in SAMHSA. Region 10 is Alaska, Idaho, Oregon, and Montana. SAMHSA divides us up like this across the country, and they have technology transfer centers where we help disseminate information. Brittany Cooper is one of the leaders of the Prevention Technology Transfer Center. I'm on the board of directors of the Mental Health Technology Transfer Center and the Addiction Technology Transfer Center. We also are part of the HCA psilocybin work group. Dr. Jay Kennedy and I are both members of that group, looking at how we think about bringing psilocybin into the state. We also have the Clinical Trial Network, or the CTN Pacific Northwest Node. This is a center grant that we've had for about 20 years, funded by NIDA. And it's a partnership between me, many colleagues, but I'm the leader here along with my friend Mary Hatch from the University of Washington, which we never compete. When we're trying to cure cancer or substance use, who cares where you're from? We want to work with the best people in the world wherever they are. Luckily, a lot of them happen to be right here. The CTN is a network of universities throughout the state that has community-based treatment providers associated with each one. And you can take a academically derived intervention and quickly disseminate it in this network to assess real-world efficacy. And actually, I'm the chair of the Research Development Committee for the entire US now. And so it's a great thing to think about if you're developing interventions. Finally, I want to just acknowledge our work with tribal partners in this space. We have many articles and many relationships here. And here's just a scattering of examples of that. Okay, I have 45 seconds to go. So next we were supposed to think about a WSU initiative. What can we do? There's always opportunities for greater collaboration, but that has to be tempered, I think, with the reality that everybody I've talked about today is pretty darn busy, and it takes time to collaborate. We don't have a lot of people standing around thinking, I wonder what I'm going to do next. And that's kind of what you need for some of that collaboration. So I think if we could attract somehow additional faculty into these areas, that would be a spectacular way to spur the collaboration. And there's so many great opportunities, again, with Murrow, with Connors, with prevention science, human development, extension. More faculty would really help with that. We've talked for a long time about a T32 in this area. That's a training grant to support graduate students and postdocs. We have the critical mass of funding now, undoubtedly, to do this, and it's just a matter of investigator bandwidth. And finally, during the COVID pandemic, some taxes were rolled back to provide relief to consumers in the state of Washington, and that impacted our ability to fully fund ADARP. So it'd be great if we could work to restore funding to ADARP so that we could really get those pilot seed grants going. So I'd like to apologize to everyone. I didn't mention my name. I probably know you're out there. Maybe there's some of you I don't know. If there is, I'd sure like to meet you, and I'd like to know what we missed. Sorry, that was a lot, but that was the order. Sure.
Let's kick it over to Jessica over Zoom to see if there's any questions or comments from our Zoom participants.
Or compliments.
Thank you, Celestina and John. So far, a lot of the comments have just been people kind of talking a little bit about who they are and opportunities that they might have to collaborate. So if others have questions or comments now and want to share those, I would be happy to share that with the others back on the Spokane campus.
Great, thanks, Jessica. And if you can write down those folks' names so that we can be sure to connect with them and make sure that they are feeling connected with the rest of the folks that were highlighted today. Thanks. Okay, well, we give the Zoom participants some time. Is there any questions, comments, compliments from here in the room? Yeah.
My compliments, John. Can you tell us a little bit more about graduate training in this sphere of activity?
Thanks. Actually, Vancouver has a program focused on substance use issues. Sadly, Dr. Mosier has passed away. He was instrumental to that. So hopefully that's getting sorted. I talked to Rennie about it a little bit. That's still there. A lot of the training happens in IPN, in neuroscience, for most of the foundational work. A lot of it happens in psychology, both experimental and clinical. A lot of it happens in prevention sciences these days. So there's also the the professional degree program that we sometimes utilize. A lot of people have postdoctoral fellows in this field, especially those who are more directly in the human health sciences, and that's become in some ways almost a preferred mechanism. And I don't know if anybody from the Honor College might be listening, but I would definitely put in a plug that some of my favorite interactions have been with honors undergrad students in these areas as well. Thanks, Doug. Jessica, did you want to add in that? And I left out Murrow. I'm so sorry. Burrow does some great training as well for folks in the communications.
John, is the T32 option or opportunity a collective type opportunity with the institution, and where does the funding structure come from?
Most institutes, Dr. Bender, have T32 funding mechanisms. T stands for training. So for instance, NIDA will make T32s, National Institute on Drug Abuse. So it's generally within an institution, but we have considered often working with UW on one in the past. If I got your question right there. Did I miss anything? Yeah.
I've got a compliment.
Thanks, Trevor.
You offered extension so often we get left out of the conversation and we're an afterthought. I want to thank you for the forethought in mentioning extension because we are a critical impact to outreach. There's so much more with those collaborations that you're doing.
Well, thank you. I can't take credit for that. I honestly would have mentioned it, but Elizabeth Waybright has been hounding me to make sure that that I have it, but I would have done it anyway, but Elizabeth and her colleagues have helped polish that aspect. And the relationship is so strong and amazing, and it opens all sorts of new venues for us to think about as we go forward. Hope I didn't offend you, Elizabeth. You haven't been.
John, nice haircut, I think. Personal compliment.
Thanks.
First time seeing you in person for a while, but
Thank you.
you clean up well. So I'm sure what I'm about to say is preaching to the choir, and you know it, but I know that when we talk about collaborating, how to build collaboration. Most of the time in my experience, it's been driven by someone seeing a gap in what they're trying to do or a need that they have. But as you went through and we're thinking about the scope of the work in addiction, what are gaps that you see that you wish we had this expertise here so we could address this? Maybe.
Yeah, thanks, Tom. Yeah, one of the last times I saw Tom, he was dropping me off at an emergency room in Nairobi. So I probably do it
I
better.
picked you up too.
Yeah.
You were drugged up enough that you don't know.
That's for another time, that story. 3 areas, I think. Agent-based modeling. I really think there's some really cool work to be done there. Marrying our work with the work Dr. Call does and colleagues in antimicrobial resistance. For instance, Sterling and I and others have a program in Sao Paulo, Brazil, where their public health response to cocaine use, rampant cocaine use, is sequestration. So you have a whole confined population of drug users. And I am pretty confident that there's some interesting antimicrobial stuff happening there. And I think that would be fun to look at. Although there's an interesting bioethical question, because I would hate to be the person who said that group is the source of a lot of bad things. So we'd have to really be thoughtful about that. As I'm getting older, the thing I think that has the most impact is a simple one, and it's loneliness. I keep seeing this over and over, that loneliness is such a powerful mediator and moderator of substance use. And I would love to get in there and really look at what's driving that. And what if you did interventions to reduce loneliness? That would be pretty cool to me.
Isolation during the pandemic, we saw
Yeah, yeah.
Can I just throw out one quick comment about P32? It's a depressing number. WSU has 2
I know.
in the entire institution. UW has 46. If we look at what we might consider peer and not aspirational institutions, they tend to run around 7 or so. One of the big criticisms going in for T32s is they say, well, that institute has so many of them.
Yeah.
You know, that they tend to start to overlap. So I think that's an important place to look and think about funding. It also helps build collaboration.
It's absolutely something we have to bite the bullet and do. It's just a matter of time. I've directed T32s. I've reviewed hundreds of them. Those are cumbersome applications to pull together. But if anybody wants to do that, let me know. Dr. DeWitt.
Dawn DeWitt, College of Medicine. John, in line with the goals of the day, it would be really great if people would introduce themselves with their names and their role when they're asking a question, so that we could then put names and faces.
Sure. Dr. DeWitt, physician extraordinaire, Doula, director of the Allen School. Uni?
So from what I'm hearing, it sounds like you may be putting together a work group in order to think about an application for a 232.
I think you are.
I'm going to throw out another suggestion, because I do know that T32s are like really hard to come by, to also then think about R25 mechanisms, which are also mechanisms to provide training at various different levels. And WSU has multiple R25s from multiple different institutes, but I don't think there is one that's from NIDA or NIAAA that is specifically focused on substance use. And so if we're thinking about a lift for that, and what's maybe more feasible, an R25 that probably provides a leg up to that T32 may be the best way to go.
That's a great point, Dooney. Dooney is an assistant professor, almost associate, I hope, in the College of Medicine, Community and Behavioral Health. And she's a lead scholar out of a really cool program that provides mentoring for junior faculty as well out of San Francisco. It's a good idea. Dr. Whitney.
Thanks, John. You did a great job of balancing breadth and depth. And, I don't give you compliments easily, because we've known each other so long, but you really deserve it today. I want to mention something that I think cuts across probably all the areas today, but because you mentioned HERC, I'll mention it here. One of the real infrastructure needs that continues, even though we've made a lot of progress, but maybe people don't know how much progress we've made, as you start to try to do some of the translational or applied work, or even work that gives feedback to the foundational work, is the infrastructure for doing community health, community-related work. And we're going to hear from Northwest Huron later today, and that's a fantastic asset. I also wanted to let people know that the Health Equity Research Center, really with the hustle of Anna Zamora Kapoor, who's got a position jointly funded by CAS and College of Medicine, she's really helped us establish a network of community health centers that are really eager to collaborate, mostly rural or Hispanic serving classic health disparity populations. She's helped us line up a sleep health disparities project that I had a meeting on this week with the CMAR network of community health centers on the west side. So this isn't just theoretical, there's actually stuff being done. So if people are interested in that, be happy to talk about it. But the final thing I wanted to mention, you mentioned faculty. And of course, that gets into budgets, that's complicated. But as new faculty on board that have these interests, what I find is they don't always know, or don't always even get the message from a particular department that these infrastructure opportunities are out there. So I think we all need to do a good job of taking folks who have potential interest and potential contributions. There's 2 new faculty in psychology that this applied to that we really made strong contact with. Let them know about Northwest Huron. Let them know about HERC. Let them know about the stuff going on in the med school, of all the centers and contracts that you guys collaborate with, and help people, because that's often the very biggest hurdle of getting into this work, is getting plugged into collaborators and a network where you can do the community work.
Thanks, Paul. For those of you who don't know, Paul is the number 2 person, I guess, at the international programs for WSU. I got to start the morning off with him and our friends in Nigeria. And Paul said he doesn't give me compliments very easy. I can't help but tell a quick little story. When I defended my dissertation, Paul was a faculty member many, many years ago, and he came after me for publishing too many articles in the same journal. I think I responded sort of smart alecky that I planned to be the editor of that journal, so it was fine. So let me publicly apologize for my cheating.
I don't even remember that.
I did become the editor.
But last one, please.
Paul.
Hey, John.
Hey, man.
I'm not
Paul's
going
the
to compliment.
Associate Dean of Research in Merle.
Thank you. I'm not going to compliment you because I give you enough compliments.
I shouldn't have even, my son was in kindergarten.
To
That was
continue
so,
beating the dead horse there. So you had a slide that was on value to the state of Washington.
yes.
And you had some entities on that slide. And I'm assuming that those entities are outside, they've been spun out of WSU research and they're now standing pretty much on their own as outside academia entities. Is that correct?
Well, the two businesses, to some extent, although I believe there's some STTR, SBIR funding, which requires the partnership opportunity to go. We have an incubator that I think is called SP3 Northwest still. That's really quite useful in helping with that out of the health sciences campus, Daryl and Celestina's team.
So in general for the room, I'd say, our interest in Murrow, it can be broadly described as optimizing media content and technology for positive impacts on public health. And that's fundamentally what we're about at a big picture level. And so I think it would be interesting to potentially hear about or figure out ways to involve these entities in what in my own work I consider academic industry partnerships.
Yeah, and I should have mentioned that, Paul. So there's the first apology. I should have had that one up there too. Great point. Just to be clear, there's tremendous opportunity to think about how we communicate, facilitated by the Murrow College, and Paul and Bruce and Stacy are here, and Jessica online. They're all great resources.
I'll ask Jessica one more time over Zoom. I have gotten the feedback though. It's really difficult to hear in the room, so we'll use handheld mics. I thought it might be fun to have John repeat Paul Whitney's whole statement, but we won't do that for this time, but we'll make sure for the other speakers. Jessica, anything else over Zoom?
No new comments yet, but I will make sure to take down the names of people who've shared information so that others who are interested in collaborating can possibly do so.
Perfect. Thanks so much, Jessica. I appreciate it. We will go ahead and take a 5-minute break. We will get back on track on time. I promise I can do that. 5-minute break. Restrooms are out that way for those of you here, and we'll come back for Eric's talk. Thanks. Okay, next up, we will have a presentation on infectious diseases. We have the Zoom moderator, Laura Lockard. Thank you, Laura, for being the Zoom moderator. And our presenter here on infectious diseases is Dr. Eric Waffren. Eric.
All right. So I'm very grateful to go after John because he laid a bunch of the groundwork, and also very upset to go after John because that was really good. But also, John, we have your phone. So this is infectious diseases. And similar to John's talk, infectious diseases is a massively broad area of research at WSU, spanning everything from basic laboratory sciences to very theoretical work. And we're not going to cover all of it today because, again, this could be its own week-long symposium. This is definitely a sampler platter of infectious diseases. So, a little bit of potato salad, a little bit of undercooked chicken, some raw oysters. I have definitely overlooked things. If I've overlooked what you've done, I've apologized in advance for that. In exchange, the first two things I sacrificed were CREED ECA and Deep Vision, which are arguably the two largest infectious disease programs at WSU, because I think those get a lot of attention elsewhere. And this is to highlight some of the other work that's being done at WSU. So one of the things that I wanted to think about while we're talking about this is that a lot of our work in infectious diseases is global. A lot of the sort of paradigms for that are built on global health. And this still has direct applications to rural, remote, and underserved populations within the United States and within our state. As we have now amply seen, pathogens don't respect borders. Antimicrobial resistance genes right along with us, so they go where we go. COVID-19 clearly doesn't care about borders. We're now seeing monkeypox, which is endemic to Africa, spreading through populations in the United States. And then the other thing is I put down here is expertise is fungible. People who are experts in infectious diseases are also experts in infectious diseases where they occur. And so, for example, we have done a lot of sewage sampling work for antimicrobial resistance in Africa and Guatemala and things like that. That expertise allowed us, when we were responding to the COVID-19 pandemic, to do a lot of very good sewage sampling work in Pullman, Washington. And then that experience is also then translated back to some of our global work, doing disease surveillance in essentially, dirty water all over the world. So these things do play very well together, and the expertise we build in one area can extend to others. So I'm going to cover some sort of, the wheel that showed up several times on John's slides. I'm going to cover those, sort of covering broad disciplines within infectious diseases. The first one is basic science with applications to public health. These slides, I asked researchers to send in sort of a brief summary of what they did in a slide picture that they thought looked cool. We're not going to cover these in detail because I'm not an expert in all of these people's research. But we have, for example, Baveka, who works on bubonic plague, the sort of OG pandemic that killed a good quarter of Europe during the Middle Ages and ushered in a massive amount of social change. And she works on a very basic mechanism of how is it that fleas actually carry bubonic plague. And it turns out that this is a blockage of their intestinal tract due to the bacteria involved in this. And this is where we get things like potential for therapeutics. If we can solve this, we will reduce the transmission potential of bubonic plague, which is because we're in the Western United States. This is still a thing we worry about in the Western United States. As you see adorable squirrels and prairie dogs and things like that, they're all carrying plague. Similarly, Coxiella, which is the source of human Q fever, is a bacteria obligate intercellular parasite. It's a bacteria that needs us and lives in our cells. And one of the questions is, what is it about an infection? What is it about the organism? What is it about the host? What is it about the interplay between those two that results in things like asymptomatic versus symptomatic infections, self-limiting infections, which are less dangerous, to very persistent infections, which can destroy heart tissue, can cause vascular problems, things like that. Why did those things happen? Those aren't necessarily just, random rolls of the dice, and the bad news is 5% of people get persistent infections. We can ask, what is it about that? And from there, again, build those sort of interventional steps that say, now that we understand how this works, we can start to figure out how to address it. So WSU actually has an extremely strong disease ecology program. It just happens to be smeared over like 7 departments, so it doesn't necessarily always look like it. So covering that a little bit, Pilar Fernandez, who is here, runs the Eco-Epidemiology of Zoonotic Diseases Lab, and she's taking a very sort of systems thinking approach to how we address zoonotic disease, looking at socioeconomic factors, ecological factors, cultural and political factors, and biological factors, and how all of those things work together, and sort of stepping towards, again, an understanding of how these things arise, and from that, how do we address them, and how do we get ahead of them? A lot of infectious disease public health is lamentably sort of reactive as things arise, and the question is, how can we get ahead of some of these things? Because if you're hoping we are in our last pandemic, I have bad news for you. So trying to address those things ahead of time. She's got projects in Gran Chaco in Argentina, elsewhere in Argentina, looking at communities that are very close to wildlife systems and then are closer to sort of peri-urban areas. She's also got a program in the Palouse looking at human rodent pathogen spillover. What is it that exists in our mice is a question that not very many people have asked, and we're trying to find that out. This is also, I think, a great opportunity for student engagement and things like that. A lot of people, if you read enough graduate application essays about why people want to go into public health, they're imagining, stepping out of the back of a DC-3 with a suitcase somewhere in Africa. And so they should, learn what tick dragging is like and whether or not that's actually something they want to do with their life. So Jeb Owen works on the ecology and immunology of vector-borne pathogens. This is a really important thing. If you think about vector pathogens, that's an interplay between us and usually insects. Understanding those insects is important. So understanding what factors impact the immune response of animals that interact with vectors, like mosquitoes, ticks, things like that. How poultry farming and wild birds exchange pathogens. We also have research on how sheep and wild sheep exchange pathogens. And this includes things like Campylobacter, which is a major cause of foodborne illness and is a big problem in sort of organic farming, backyard farming, things like that. Multi-host ticks, things that bite us and other things, and how those impact each other. And then also, again, looking at ways to teach students, introduce them to zoonotic diseases and introducing them to zoonotic diseases in the context they're in minority rural populations in Washington state. So Stephanie Seifert works at the Molecular Ecology of Zoonotic and Animal Pathogens Lab, and she's doing really cool work trying to understand sort of the whole system. Anything from what are things that arise in the cell to how ecosystems work, and really understanding how those things interplay with each other, which means there's a lot of opportunity for collaboration as we think about all of the various disciplines that are represented at WSU. Flying through these. So onto epidemiology and antimicrobial resistance. This is my area of interest, so it's near and dear to my heart. So we have a lot of programs in communities and hospitals internationally. So WSU investigators, Doug Call is in charge of this, are leading 2 CDC-funded cooperative agreements in Kenya and Guatemala. There are also 4 other studies in Bangladesh, Botswana, Chile, and India. And the objective of these is to really understand what we're looking at in terms of antimicrobial resistance over the globe. Because again, these are pathogens that don't particularly respect borders. These are things where medical tourism, regular tourism, livestock handling, things like that, all end up moving pathogens around the globe. Plasmids are more than happy to hitch a ride and colonize your guts, and trying to understand what are the risk factors for colonization with these organisms, because in different contexts, those are different. One of the things that has arisen in antimicrobial resistance is it's a very complicated process, and a lot of different groups really, really want to blame someone else for it. The livestock people say, well, we don't use human use antibiotics, so it's the fault of the clinicians. The clinicians say, look at all the antibiotics the livestock people are using. You get these sort of interactions between things, and the answer is it's just very complicated. There's also the interplay between, in the developed world, a lot of this is due to antimicrobial stewardship or a lack thereof, the overuse of antibiotics. But in the developing world, there's also a aspect of sanitation. That the reason you have drug-resistant microbes in your gut is because you're just exposed to a tremendous number of them through sanitation problems. So for example, this is a look at the prevalence of the scary type of E. coli in some sites in Kenya. And you can see these numbers are, if you're at all familiar with antimicrobial resistance, really frightening numbers. If you talk to clinicians in these areas, how do you do antimicrobial stewardship when almost everybody comes in with a drug-resistant pathogen? Things like that. What does it mean to do these things? And then one of the big questions around the pandemic is what has happened to antimicrobial resistance during the pandemic? There's just so stories that go sort of both ways. That like it probably got better because people were much more disciplined with antibiotics because everybody who's sick has viral infections, so we can stop using antibiotics. The other just so story is everybody is sick all the time and we're doing telemedicine, just give them all the drugs and we'll sort it out later. And the answer is it appears a little bit of both of those things are true, and trying to understand that and in what context. So the CDC has come out with sort of national level estimates for that and what happened, but did that happen in Spokane? Did that happen in Pullman? Did that happen in Seattle? And did that happen in all of those places the same way? So Amin Islam's lab looks at drivers of antimicrobial resistance that are both anthropogenic, so things we did, and natural drivers. So heavy metal contamination can promote antibiotic resistance. Essentially, the genes that protect microbes against things like arsenic often right along with the genes that protect them against things like antibiotics. And trying to understand then how do we intervene on those things, and what does the microbial ecology of those pathogens look like? Did you get infected in your gut because you were on antibiotics, or are those microorganisms just better at infecting you? So there was often, again, a sort of just so story in antimicrobial resistance, that antimicrobial resistance always has a fitness cost. And so if we just stopped using the drugs, the susceptible bugs would come back because they're more fit and everything will be fine. That's not true, as it turns out. We've seen that with community-acquired MRSA and things like that. And so the question is, what is it about these pathogens that is maybe letting them escape that sort of fitness cost? And again, this then translates to very applied interventions on the ground. He also has a project with Feed the Future, funded by USAID, looking at major sources of antibiotic-resistant fecal pathogens in aquaculture. And this again, we're a state that does a fair amount of fishing, or a state that does a fair amount of livestock. These questions about how do things get contaminated, how do they enter our food supply, are questions that are pressing both internationally and within the state of Washington. We have along the same lines the Washington State Resistance Epidemiology Modeling Initiative, aka REMI, that it was funded by an ORAP team planning grant a couple years ago. We shifted a bit to COVID-19, as did basically everybody who has epidemiologist in their title for a couple years. And this is a partnership between, it says SGH there, it's the School for Global Health now, the Electrical Engineering and Computer Science School, and other partners, including sort of nascently trying to involve both the nursing and medical schools to work on bringing advanced data analytics to the problem of antimicrobial resistance, and making sure that those are accessible to rural and underserved populations. So there's a lot of very cool data science work, very cool modeling work that's being done in this space that essentially involves you knowing your nearest tertiary care academic medical center. And that's not necessarily something that will apply to a lot of the populations we're talking about. And so we have a lot of work trying to figure out how to translate those to rural settings. Do the guidelines put out by national organizations make sense in rural settings? Are the tools accessible to people in rural settings? Can we do things like tele-stewardship programs to help rural hospitals that maybe have, you know, one antibiotic stewardship nurse who also has 3 other titles, you know, support some of their work and things like that. We have successful funding here from the NSF. We're looking at COVID-19's impact on healthcare settings, the CDC for the same. We've recently got an award for the CDC for workforce development for modeling healthcare associated infections. I think this is very important because we're now in sort of a new paradigm of public health. Unfortunately, with the pandemic, prior to that, there was sort of an assumption that the US would have a very centralized response to public health, that essentially your local and state health departments would sort of hold the line long enough for the CDC to show up and sort things out. That didn't happen, candidly. And so now we are genuinely trying to figure out, what does it mean to need modeling and analytical resources at the level of the state, a local health region, a university, a hospital, you know, individual hospitals were trying to forecast COVID. That's a daunting task that needs a lot of expertise built up in it. And then we recently have a Mirror Award for modeling small structured populations. That includes things like hospitals, schools, very potentially, you know, populations of drug users in Sao Paulo. And these are some of the people involved with it, myself, Ananth, and Asifa in the CS department. Finally, we have an infectious disease dynamics and computational epidemiology strength here at WSU. This includes Alyssa Schwartz, who John mentioned, who has been working on behavior modifications in models. One of the things that really caught modelers off guard during the pandemic was the role of behavior. It turns out people are not rational actors. The whole, you know, homo economist thing, not true for public health, also not true for economics. And, you know, understanding things like that, looking at immune system drivers for vaccines. So this sort of complicated picture here is essentially a model showing that even if a vaccine works pretty good against a wild type virus, that you can get mutant strains that start to proliferate. That's scary as we think about COVID and our current vaccination levels. One of the really cool parts about Alyssa's position is she splits her time between the math and statistics department and biology, which means she can partner with people who then validate this with real data. So this model is actually built off a virus in horses. Snow is sort of on the very theoretical side of infectious disease dynamics. She works on mathematical modeling. She's done stuff on the cholera outbreak, stuff on COVID-19. One of the things you'll discover if you work with modelers a lot is we hop around a whole lot. We'll model anything if you give us a chance. So we'll happily do agent-based models of drug and substance abuse. And the last thing I want to make sure to mention is how all of this sort of shaped WSU's COVID-19 response, because COVID-19 sort of took everybody by surprise in terms of the magnitude of its impact on college campuses. College campuses, in terms of epidemiology, are often not thought to be that big a deal. You have the odd norovirus outbreak in a dorm, you have a lot of STIs, but like in terms of respiratory illness, like, oh my God, what about the college kids? Is not normally a thing we worry about. But it turned out to be a very big problem in college campuses. We did a lot of work on a very short turnaround time, looking at a number of different questions. Two examples I have up here is a question that cropped up sort of in late summer of 2020, which is, so what about football? At which point I went, oh no, what about football? And so we did some modeling asking under a number of different assumptions, you know, what is the prevalence of visitors coming to WSU for football? How well do they mix with the student population? We don't have parameters on any of those things, so I ended up asking a bunch of staff who are alumni of WSU, like, so how much do the grown-ups hang out with the students at football games? Which is a really informal way to do it, but was fun. Asking the question of how many excess cases on campus can we expect if we have in-person football as planned in the fall of 2020? The answer is a lot. Thankfully, the Pac-12 canceled that football season, but that was something that we needed to also know, because as we think about things like student testing and student isolation, do we need to plan for a bolus of cases a week after every football game? And what does that mean for isolation dorms and testing capacity and things like that? We've also been working a lot with Whitman County Public Health over the entire pandemic. And one of the things that we were trying to figure out is, as we saw these epidemics, it looked like we were actually having two epidemics in Whitman County, the one on WSU's campus and the one in the rest of Whitman County. There was a huge amount of fear sort of in about this September and October time period of sort of waiting for the shoe to drop and this huge spike in cases in the college population to just hit the community really, really hard. And because Pullman is a rural city in a rural county, we were expecting things like a huge number of elderly people to get sick, for this to impact the nursing homes in Pullman and things like that. And it turns out it doesn't look like that actually happened. And so now we're trying to figure out, well, why not? So that we can understand, was that the mitigations we put in place? Is that the sort of natural mixing of populations within these states? We're also asking other questions like, a lot of our states, a lot of our cities, Spokane and Pullman included, are across the border from Idaho, which had very different public health policies. What does it mean to have essentially heavily linked communities that are under entirely different regimens for how you handle public health? What does that mean for the burden of the state agencies in that? And so this is the lightning round version. This is everybody who I got to the end of the slides and went, oh my God, I haven't mentioned them yet. So we have a program right now with iReach, looking at COVID and social networks in Marshallese populations, trying to understand essentially how heavily connected these are. We worked on COVID-19 in jails and detention centers, which was a partnership with WSU, the University of Tennessee, and the ACLU. We have joint faculty with PNNL, looking at alternate sources of surveillance data, looking at the role of companion animals in COVID-19 transmission. That's a partnership with UW. Contact estimation, understanding how healthcare providers interact with their patients in low and middle income settings, in rural hospitals, and in veterinary settings. It turns out epidemiologically, you can use the same tools to ask the same questions. You know, Sterling's missing data problems. If you ever want to feel better about your missing data problems, talk to the disease ecology folks. And then the last thing I want to mention, because it's not the least, is there are very logical extensions with extension. Veterinary and human health are not that far apart. And they're especially close together in rural, remote, and underserved communities, where you are talking about people who are used to the idea of, well, you're going to need some antibiotics for that. You're used to people who are used to being met where they are by extension. And we can do that for public health, but we need that expertise. We need that local context. Because what we have seen during this pandemic is showing up and going, you know, don't worry, we're here to help. Doesn't necessarily resonate in those communities, and we need to figure out a way to fix that. So thank you all very much for your time and attention. If you want to talk to me specifically, that's my email address, and I'm extremely online, so that's my Twitter account. And that's it.
Let's shift it over to you right away over Zoom. Are there any questions or comments from the Zoom participants?
We had one comment from the ORAP group. There's a lot of folks from the team in the audience, and they're really excited to see the planning grants in action.
Great, thanks so
And
much, Laura.
Go ahead.
Oh, anything else over Zoom?
No, that's it.
Great. Okay, what about here in the room? Yes, go ahead. And please introduce yourself.
Hi, Chris Emerson, College of Medicine. Thanks so much for a great presentation. I want to ask a kind of provocative question, which is, we are a very large academic institution doing fantastic work on the COVID pandemic. And my provocative question is, touching on that very last point you made, how are we going to reach these communities and these groups of folks in our region and across the country to accept the science that they're doing and, in the interest of the next pandemic, when it does come along, to improve on our response? And I know this is a very challenging question, so I'd be very interested to hear your perspective, Dr. Lofgren, and just also anyone in the audience who might have a perspective on that.
I think if I had the full answer to that question, I'd have written a book on it by now. So I think one of the answers is public health has to do a bit of soul searching. There were parts of our response to this pandemic that can be classified as failures, and trying to understand how those occurred, where we can do things better, partnering with people like communication. One of the things I encountered a lot with epidemiologists is none of us have media training. And that turns out to be a little bit of a problem. And so I think one of the things is figuring out how to reach those communities, how to communicate with them better. And the other thing is to do it ahead of time. One of the things that we did a lot during the pandemic was to try to figure out who we needed to talk to right now. And we can see that everywhere from our response on the Pullman campus, asking very basic questions about how college students interact with each other. And the answer is no one's bothered to collect that information, all the way to the people in these communities should know who we are, should know that we work on public health, should have been able to see results that improved their lives well before we're asking them to take a risk on, mRNA vaccines sound very cool, but also sort of scary. What does an emergency use authorization mean? Things like that, building those relationships ahead of time so that some of that trust is already there and they can see us, following the mission of WSU, serving the people of Washington State, building those relationships and making sure that those are done ahead of time. And I think with some of the impacts of the pandemic, that's going to be a very long and very difficult road. But it's something we need to sort of commit to trying to do.
I'll hand over first. Can I just respond real quick? I've had the good fortune lately of being in some conversations with National Extension Foundation over their Excite program, which is all about vaccine education. And we're fortunate to have a Excite 2 grant, in Murrow with some other collaborators. And I can tell you that Excite 3 is around the corner, and that part of the National Extension Foundation, as I'm sure the extension folks in the room are already familiar with, is focused on communities, whereas Excite 2 has been focused on how to effectively reach extension agents themselves and get them on board with being basically what I call tongue-in-cheek vaccine ambassadors. I do know that in conversation with Extension Foundation, CDC views Extension as a crucial partner in reaching rural audiences. So I think there's a huge opportunity for those of us here tied to Washington State University to look at that funding and look at advancing, partnerships through extension, through CDC and these other mechanisms to reach out and educate rural communities on the science. And part of the project we've been doing in Murrow works around the whole notions of science literacy, media literacy. And that's a major area of expertise for Erica Austin. Some of you in this room know Erica. And so I think that plays a role to what was just being discussed as well. Thanks.
Trevor Lane, Washington State University Extension, Community and Economic Development. That very provocative question was extremely touching to me because I hear often as a guy 68,000 miles on his vehicle in the last 19 months, I'm out there with people in the trenches, and I'm hearing often that we're not talking to the communities that we're designed to serve. And so as I work with tribal and rural communities, thank you for that provocative question. I think you ended your presentation with the answer to all the questions that you asked. And thank you for that follow-on piece, because that's what I was going to mention as well. So it's a compliment. Kudos to you for all of your work. I think you answered the question with where you ended with extension. And there's a lot that we can learn from and with each other in collaboration because we're in the trenches with you.
Yeah, I appreciate that. I think one of the aspects of that I think will be critical because the CDC has also been interested just in rural health more generally. I found that our applications that use that particular sort of framework tend to get picked up better. Is making sure we also support extension. Y'all are busy people. And so adding another job onto that, which is a lot of what public health response has been generally, is just finding people and saying, great, can you do this too? Isn't sustainable long term. So as we talk about adding sort of a public health role to extension, figuring out how to build that in a sustainable way, because again, we need to be here for 10 years, not just for the course of the pandemic.
Eric, every time I hear you talk, I'm humbled. I wish I were 20 years old and you're a graduate student.
I'm looking for postdocs.
See what my next grant would be goes. Chris asked a provocative question. Paul and Trevor gave some responses, as did you. I know online, Tom May, the endowed professor of bioethics for the College of Medicine, was out there. He and I were talking this morning about making these decisions in bioethics framework where what's good for one group isn't good for another group, and the metric you use for good in one group can be different from a metric. And I wonder if, in addition to the great suggestions from Trevor and Paul, if there are opportunities for more of a bioethic common shared good.
I think there absolutely are. One of the groups I didn't touch on that actually has a lot of work in this area is the School of Economic Sciences. That they do a tremendous amount of work trying to understand that. I think there are some very interesting sort of ethical framings to some of this work. There is, I'm going to use healthcare associated infections because that's what I do most of the time. There's questions around compensation that actually get at sort of fairness and equity, and do you want to punish poor performers, and will that just mean they're doomed to be poor performers forever? I think during the pandemic there was a really interesting sort of ethical issue that we actually wrote a grant to try to approach mathematically. It unfortunately didn't get picked up. Looking at generally for healthcare associated infections, the assumption is healthcare workers aren't at risk. That if you get MRSA on you, you'll clear that and you'll be fine. That's obviously not true for pandemics. And so a lot of the things you do to help control large influxes of infected patients, things like cohorting patients so that they're only seen by one provider if they're believed to be infected, actually shift a huge amount of burden in terms of risk to a single healthcare worker. You sort of picked a nurse and said, if someone's getting COVID, it's going to be you. And what does that mean from an ethical standpoint? How do you sort of optimize? It's easy to optimize a response if you're just looking at patient infections. It's much, much harder if you're trying to look at both patient infections and avoiding provider infections and things like that. So I think there's definitely a framework to think about that. And you have competing groups. So one of the things we saw for COVID-19 in Pullman particularly is the group that was the most transmitting group and the group that were at the highest risk are different people. And so what does it mean to vaccinate when the people who will stop the pandemic are not the people who will die if you don't stop the pandemic. And so I think there's a lot of ethical and sort of trade-off questions and equity questions that can arise in infectious disease research.
Thanks so much, Eric. Laura, I'll get over to you really quickly. Any last comments from Zoom?
Oh, yes. I did want to call out the alignment with the Allen School and Infectious Disease Research and the priority number 5 in the Washington Department of Health Transformational Plan. It's very aligned, and I think that's something that offers more collaboration post-COVID work. There's a few people that are very interested within extension, in collaboration and working in partnership in the communities, as well as hospitals in the hospital industry. So we'll connect everybody back to you guys after this conference.
Perfect. Thank you so much. Thank you, Eric. Thank you, Laura. Thanks for all of the great comments here. Excellent. We are going to jump right into our next speaker, Dr. Courtney Meehan. The Zoom moderator is Dr. Masha Gartstein. And Courtney is going to be talking about reproductive, maternal, and child health and the public health related research. And then we have a lunch break. So looking forward to that too.
Hey, good morning, everyone. Thank you. I've been incredibly impressed at the turnout for this event. And so thank you, Celestina, for organizing it. And when Celestina asked me to give this talk on reproductive and maternal child health, I answered enthusiastically. And I actually said, well, I got the best topic. And I think I did, but no offense to my other presenters here today. But it's hard to go wrong with moms and babies here. So what I'm going to talk to you about today is that for years, I've recognized that we have a critical mass of faculty engaged in reproductive and maternal child health research. And even more importantly, we have a critical mass of faculty that are doing this work in rural, remote, and underserved populations. And we're doing this in the United States, and people are also embodying that philosophy of our land grant mission and taking it around the world as well. So let's see if I can get the remote working. Here we go. I'm relying on my notes here today because I have lots of names I'm going to try to introduce to you. But when we think about research, WSU research on reproductive and maternal child health, one key feature that I think we bring to the table is a holistic approach. Our work is foundational, it's applied, and it's translational. And as John noted, these boundaries are fuzzy. We have teams that are doing foundational and applied work. We have teams that are moving through all of these areas. Additionally, we have teams at WSU that are working in social determinants of health and have a major component of that being public health communication, dissemination, and implementation. And so as I talk to you about some of the work that's been going on today, I'd like you to keep in mind those fuzzy boundaries. Most of the individuals working in this area have become parts of large teams over the years, and we are collaborating with each other and working toward kind of blurring the boundaries. And so before I dive in, though, I want to take a brief moment on how and where I got today's information, because I'd like to thank the faculty that reached out to me, those that responded to a survey, and all of those of you who keep your websites up to date, because I've been scouring them. I won't be able to cover everyone, and we'll be talking about broad themes, but it's been a kind of a fun journey over the last few weeks. And so in terms of an outline, I'm going to start by giving a really broad stroke overview of themes. I'm going to then try to frame that. I think one of our goals here today is to think about how we might frame the diversity of work that we're doing. So I'll take a first stab at it. And I also believe strongly that the best way to move a conversation forward is for somebody to put something on paper for everyone to disagree with. So to start, we have an enormous strength in reproductive biology at WSU. We are home to the Center for Reproductive Biology. We also bring to the table a wealth of research on the social environmental determinants of maternal child health. We were asked to comment, all of us were asked to comment on mental health and substance use as part of these talks, so I'll also mention that as well. We have a body of researchers here doing that work as well. A third major theme at WSU is health communication and improving access to health services. And finally, because we bring a very holistic approach, WSU researchers have been incredibly successful at responsive research to address emerging health issues in this in this area of reproductive and maternal child health. And so to start, I'd like to thank John Oatley, who sent me a wonderful summary. This is an enormous group in the School of Molecular Biosciences, the College of Veterinary Medicine, and the Center for Reproductive Biology. We have work by Dr. Roberts and Chauvin's research on male reproduction and fertility, Dr. McLean's work on understanding molecular mechanisms that underlay ovulation dysfunction. We have Dr. Bernhardt's lab, which is investigating determinants of early embryo quality and how mechanisms of fertilization and egg activation contribute to offspring health. We have Dr. Skinner's work, his epigenetic work, and Dr. Hunt's groundbreaking work on BPA. And that's just a few examples of the numerous faculty in this area. While much of this work is being conducted with animal models, this foundational applied research has translational human applications now or will in the future. We also have an enormous body of work being done on the social and environmental determinants of reproductive and maternal child health research. We have researchers that are looking at growth and development. Dr. Aaron Blackwell is looking at pubertal timing. We're looking at temperament, parental response to risk. Dr. Amber Fife Johnson at iReach examines health disparities in young children and how outdoor play impacts health outcomes. Researchers are also engaged in applied and translational work. For example, Dr. Sarah Waters recently published a paper examining a translational pilot program aimed at the prevention and amelioration of the effects of stress on child development. Most of this work is being conducted in rural and remote settings, and much of it is being conducted around the world. The necessity of that global perspective can't be understated. We need equity and diversity in health research. I understand I'm speaking to the choir here, but we must broaden our understanding of health, and WSU researchers have been doing this for decades. In terms of mental health and substance use, we have researchers that are groups of researchers that are focused on both these areas. Dr. Garnstein, who is our Zoom moderator for this session, and Waters, a human development faculty in Vancouver, examine maternal stress symptoms and disorder, parent-child interactions as contributors to emotional reactivity and self-regulation. Dr. Edward Hagan in WSU Vancouver has expertise in maternal postpartum depression and is beginning work on a WSU collaborative study examining the gut-brain axis, understanding maternal infant microbiomes and maternal depression. And Dr. Chris Berry's research in psychology looks at risk and protective factors related to child and adolescent behavioral problems. In terms of substance use, John covered quite a bit of this, but I'll kind of narrow it down to focus specifically on reproductive and maternal child health research. Our host, Dr. Celestina Barbosa-Leiker, has done extensive work on perinatal substance use in at-risk and marginalized populations. She's done this work with Dr. Crystal Smith and others. Dr. Ryan McLaughlin's work is examining how prenatal cannabis exposure is associated with offspring outcomes in an animal model. In my lab, along with my collaborators, Dr. Gang and Dr. Celestina Barbosa-Leiker and others, are examining whether cannabis use during lactation is related to changes in human milk composition and infant development. Dr. Haishi in the School of Molecular Biosciences has conducted research on how cannabis exposure may impact reproductive function. And Dr. Willoughby in communications research not only highlights our communication research in this area, but will transition us to the next theme. She's working on message development for risk reduction related to cannabis use during pregnancy. And so moving to health communication, improving access to services, WSU researchers, Dr. Erica Austin, focuses on how pregnancy may change parents' mental process messaging about vaccination, specifically how women's psychophysiology health during pregnancy may make them more susceptible to disinformation. And Dr. Willoughby and O'Donnell's work focuses on effective communication and message design on sexual health to adolescents and young adults. And Kelsey Pascoe's research is centered on improving perinatal health services for justice-involved individuals. In terms of the teams that we've put together over the years and the work that we've been doing, the range of expertise we have and the holistic approach, it has made it possible for WSU researchers to respond quickly with collaborative projects to emerging health concerns. We need look no further than the last 2 years in COVID-19. WSU researchers have looked at stress, coping, and resources needed among perinatal women during the pandemic. They've looked at substance use and mental health in pregnant women also during the pandemic, and whether human milk transmitted SARS-CoV-2 virus, it doesn't, and whether it contained durable antibodies, it does. These interdisciplinary teams included Dr. Barbarossa-Leiker, Waters, Crespi, Verduli, McPherson, Smith, and myself, and there are numerous others in reproductive biology who have also been working in these areas. And so I asked, when I reached out to everyone, I asked, in what ways is WSU research providing added value and innovation to the state? And here are some of the responses that I received, and I'm sure we can add more to this today. We are informing intervention strategies for at-risk infants, mothers, and their children and their families. We're raising awareness of perinatal substance use in Washington state due to the legalization of cannabis and the opioid epidemic. And we're developing healthcare interventions to improve outcomes for these women and their infants. We're increasing access to perinatal and child healthcare for marginalized and disadvantaged population. And we have the potential to improve the health of generations, as well as have a positive impact on the social determinants of health for pregnant women in the community. I've also heard that we are distinctive in this holistic approach and our established collaborative relationships that bring expertise in media, psychophysiology, neuroscience, social science, biology, nursing, community-based research, outreach, to biologically grounded approaches aimed at optimizing maternal-child health. WSU researchers have also been working hard to make connections with local, state, and regional partners. When I asked everyone who they were partnering with, I have to admit I didn't ask this in quite the right way, so I had to pull this information out from responses. But even just pulling that information out, I think we can see that WSU researchers are making connections all across the state and region. They're working with Providence, Multicare, Spokane Regional Health, Pullman Regional Hospital, Spokane County Jails, local high schools, and more. We are also partnering with universities around the country. Again, I didn't quite ask this in the right way, so I was pulling this information out a bit, but we are partnered with researchers at Harvard Medical School, Emory, UCLA, University of Rochester, University of Washington. And we also have collaborators and partners around the world that help us engage in local communities. We are working in multiple countries throughout Africa, Europe, South, Central, and North America. In terms of extension, I think this is one of these gap areas that we can really focus on. For those that I spoke to and those that responded to my outreach, in the area of maternal child health, it has been somewhat limited to date. There's a notable exception, which was just discussed a few minutes ago, which is the Excite team, and looking at vaccine hesitancy. And that is that was such an exciting example to find. But I think we can do better. But I will note that when I reached out to everyone, the most common response I got was, we want to do this. We have a desire to do it. we don't know how to do it. And so I think as administrators, we need to be able to help people make those connections. In terms of responses to what is needed to continue or grow this research, the overwhelming response that I got was connected to research or organizational infrastructure. There's a desire for more, well, I should step back there for 1 second. I think there's a desire for that research or organizational structure because maybe it was what John said as well, that these are busy individuals. And I think faculty are looking for someone to take a leadership role, to kind of pull everyone together, to be able to start to build that infrastructure that will help them make connections, build collaborations, work with extension, et cetera. There's a desire for more connectivity between animal and human sciences, a desire for additional opportunities for partnerships between clinicians and researchers. I heard multiple times that faculty are trying to work out how to make connections and build partnerships with OBGYN departments. There's a desire for strategic faculty hires to fill gaps and build out emerging strengths. There's the acknowledgement for the need for training grants and additional faculty positions. So what do we bring to the table though? Many of these were already discussed, but I want to highlight them. We have the Murrow Center for Media and Health Promotion Research. We have an outstanding Center for Reproductive Biology, the Center for Cannabis Policy and Research, the Health Equity Center, and faculty have even put together, their own collaboratives to build out these networks amongst each other. And a great example is this WSU COVID-19 Infant, Maternal, and Family Health Collaborative. And so how can we frame the research in a way that brings our expertise to the forefront while providing value to rural, remote, and underserved communities in Washington State? So I took a first stab at this, and again, this is where it comes into put it on paper so everyone can disagree with you. I would say that broadly speaking, our research in this area falls into two major categories. First, the first 1,000 days, focusing on that critical period between conception and about 2.5 years, where those nutritional, developmental aspects of infant development have lifelong implications. And then second, that child and adolescent health component. I think combined, these broadly, not perfectly, but broadly represent some major themes within this area in our public health research. In terms of potential outcomes for a WSU initiative on this topic, responses that I received focused on that we have the ability to improve understanding and response to health disparities in these communities, and that we can contribute to the development of inclusive health systems through training and our graduates. We can bridge global and local health, and we can provide expertise and assistance during emerging health crises to populations that are underrepresented in health research. And I'll start by noting that, pregnant women, the perinatal period, and children by themselves are underrepresented in health research. That period in particular is often referred to as a period where women are therapeutic orphans, where there just isn't anything out there for them to find, and the information is not there. And so even just beyond, looking at rural, remote, and underserved, this in itself addresses a underserved public health, component or population. And so I'd like to thank the WSU reproductive and maternal child health researchers. I too will move quickly before you can find your photos or lack thereof. And I want to end by really starting the conversation by what are we missing? How do we frame the work we were doing? And really what are our next steps? And I can turn it over to Masha for the Zoom.
Hi, everyone. I just put a question into Zoom asking those who are on Zoom to share their questions and comments. Thank you, Courtney, for that a wonderful presentation. It really, I know a lot of the work that you spoke about, but just the breadth and the connections that we have are so impressive. So if you have questions or comments for Courtney and you're watching on Zoom, please put something in chat and I will share it with everyone.
I'm going to open it up to the room. Any items for conversation?
Thanks, Courtney. College of Medicine and maybe Don DeWitt or Chris Anderson can comment more on this. Just announced, I think yesterday, that we have a new thread director for OBGYN. That seems like a person who would be a great connection to this group. Dawn Copey, I think it is.
Yeah, it's Dr. Dawn Kopp, and she, I think, has a master's or a PhD, a master's in public health, I think, from Chapel Hill. So she's very interested in this space. I think she just would like to be invited in, since she's new to the organization.
That would be fabulous. Thanks, John. Yeah.
And so that's one exciting development, and another very exciting development that this group may not be aware of is that the College of Medicine is going to planning to start a new pediatric residency in Spokane, which is an incredible area of need that I think is very relevant to this topic.
That is fabulous news too. This is
Keep them coming. New collaborators.
Well, and Chris Anderson, who just spoke, is kind of director of PEDS.
It's a fantastic talk. Thank you. Monica Su from the College of Medicine as well. I'm just curious in the sort of present political milieu role, this is era, how has your research sort of shifted? We heard about sort of COVID providing opportunities and also lots of stuff. I'm curious how we're adapting as a university.
sure. So, well, I'll speak from personal experience then, if that's okay. So when the pandemic hit, my colleagues and I switched gears almost immediately because it's hard to remember back that far. But when we were, at the start of this, there were reports coming out that human milk had the virus in it. And this could have had disastrous consequences around the world if everyone started encouraging women not to breastfeed. And so we completely shifted gears and started to do that work. And there have been numerous researchers. I don't know, Celestina, you want to talk about your work?
Well, I think too, it was a little bit difficult to hear. I'm sorry, Monica, but like COVID, like the pandemic, having to pivot quickly from Roe v. Wade.
Oh, I'm so sorry. I just misunderstood that. I was like, oh, I was gonna avoid talking too much about that stuff. Oh, so I don't believe that I don't know any examples right now of work in that area. Do you?
I think just editorial board work will have a special issue on a psychology of addictive behaviors is going to do a special issue on the intersection between substance use and reproductive health as it's been impacted from Roe v. Wade. So I think we'll start seeing some of those come out. I think a lot of our work, kind of like with the pandemic, is already related in these very disparate, unequal groups and communities that are impacted by significant policy changes or things going around the world. So I think we'll see that coming out more and more. Thank you.
I think Janessa Graves College of Nursing, and I would just say to add to that, I think we are positioned geographically very aptly to do some access to care work for Idaho residents coming over the Washington border, both in Pullman, Spokane, and perhaps Newport. And so I think that's just an opportunity to look at both access to care, but also mental health implications of that sort of impact that we're going to see in Washington.
I would love to follow up, given that 2 of our campuses are right on the border. I think that, yeah, exactly what you're saying, but I would love to follow up with you on that because I think we, obviously are going to be seeing, the outcome.
Yeah, Stacy Hess, Morrow College. I think the other aspect of this is prior to, pregnancy occurring, right? Sexual consent, sexual assault reduction, which is my area of work. And I think that's going to play an even bigger role when we look at the effects of Roe v. Wade and how it's going to affect maternal health. And I loved your presentation. You did a really great job encapsulating everything.
Dawn DeWitt, College of Medicine. So one of the wonderful things about hiring Dawn Pop is we brought more talent into WSU, but it takes her out of clinical practice and it takes her out of, to some degree, clinical teaching. And one of my big requests is for research that will look at the economic and access impact of people here in Spokane who are having decreased access to maternal and child health services because of the influx from Idaho. And I think for states that have big borders like we do, and there are lots of those states, quantifying the economic impact and impact to Washington State residents and Spokane residents of having providers trying to genuinely care for everyone, it is really a challenge that we need to look at from a research point of view.
Great point. Thank you.
Just a comment. Thanks for a great talk. I'm very familiar with, Ken Roberts, College of Medicine. Very familiar with the work of the Center for Reproductive Biology, but not so familiar with the other work that you presented. So thank you for bringing those two things together for us. I think there could be probably a larger conversation with the center, around things that those working in the center on very basic questions should be aware of in terms of how more collaboration could bring them, out to the public. And one thing in particular comes to mind. There's a thread through the Center for Reproductive Biology besides infertility and sort of reproductive issues. There's also a thread of contraception through the work that is focused on both male and female sides, but some significant work on the male side. And there's a longstanding collaboration between a couple of groups and a couple of groups at the University of Washington that have now resulted in some preclinical trials and so forth. But one of the aspects of this at the NIH is very important is just sort of the behavioral component of that, and sort of, even if you developed it, would people use it and how would they use it and those sorts of things. And I think as we move forward, especially in a post-Roe world, this topic may be something that becomes even more important than it actually really is now.
I think that's a great example of some of these areas where, we can identify gaps that are bringing us together more. If we can find, individuals who are, in that area and can make these connections. I heard from faculty, both from the Center for Reproductive Biology and in the social sciences and in the medical campus up here, that there is a desire to connect the human and the animal studies that are happening. And this is a great example of, how we could fill a gap in terms of faculty and researchers to try to make those connections.
Oh, Whitney, I really appreciated the fact that you did some data collection along the way. And it really struck me, Courtney, that the responses that you got about infrastructure assets and infrastructure need not only applied to this area, you could see it probably applying to most of the areas that are across the disciplines today. So just to anticipate the end of the day, I think a next step we might think about is if we plan, and I'm not putting this on you, Celestina, but if we plan another symposium, I can well think a good next step topic would be to look at those infrastructure needs. I see our good friend and ally is in the front row, Chris Keene. Perhaps with the Office of Research, we could have a symposium where we talk through the infrastructure needs. What do we have? How do we get to the next steps? And that really might help tie us together even more. That's good, Paul.
Thanks. Let's get over really quick to Masha. Any last comments from Zoom?
Yes, there's a comment about the holistic perspective on healthcare, and I'm assuming because of our topic, perinatal healthcare in particular, that we really need to also take the physical environment into account. So architecture, interior design that can either promote health and well-being, or sort of serve to its detriment. So anybody who's interested in collaboration around that, we have some information in chat.
Great, thank you. Thanks so much, Courtney.
Yeah,
Excellent job.
thank
This
you.
is great. Thank you. Very quickly, I want to do 3 quick introductions for folks that weren't able to be here at the start. Dr. Tao Kwan-Get, I believe, is now here. Yes, hello, welcome, thank you, from the Washington State Department of Health. And then we have Vice Presidents Kerr and Keen, who are also here. The 3 offices here are co-sponsoring this event, so thank you. We've already had 3 amazing talks. We still have 3 more. We're halfway through. I'm trying my best to keep everyone on time. We're going to take a 30-minute lunch and come back at 12:40. And then really quickly, Kevin and Patrick, if you have your slides, we can load them during lunch. Yeah, great. Thanks. Enjoy lunch. We'll see you in about 30 minutes at 12:40. During this time, before we go into our last 3 research presentations, we do have a state legislative agenda update from Vice President Kerr and Chris Mulick.
Thanks, Celestina. Hi, everyone. It's so nice to see you. So I realize I see a lot of familiar faces, but there are a number of people that I don't know. So let me just introduce myself quickly. My name is Colleen Kerr. I'm Vice President for External Affairs and Government Relations. You all know me for lobbying reports that you receive 8 times a year. So that is my claim to fame. I'm also affiliate faculty in the Allen School, which has really been a pleasure for me over the past 12 months or so. I'm going to hand it over to Chris to talk about our legislative agenda and what we're going to be submitting to the Office of Financial Management this year with respect to a state request. I wanted to provide a little bit of background on that because I want to make sure that we recognize kind of the background that goes into this year's state requests. So one of the things that happened in the pandemic is I'm going to quote from David Bain actually yesterday, Tao. He said that in the course, so he's with the Department of Health, and we had a really good meeting with him. And one of the things that he said is there had been moments during the pandemic that had given the Department of Health for the opportunity for self-reflection. And I really thought about that after he said that yesterday, because I think we had that at WSU a number of times through the pandemic. There were things that happened, and Eric talked about some, and Courtney talked about some, where we had moments of self-reflection. I see Paul, I know that we had that experience together where we kind of looked at what we had done together. I think back to a meeting in this very building in 2014 where we had looked at what we had done together, and then we were able to kind of self-reflect on where our expertise is, what we want to achieve, and what's happening in the state of Washington. And that is the background for this symposium today. One of the things that came up, so we had an in-person meeting in Pullman last summer, and one of the things that came up was we have expertise. How are we able to strategically invest and to make decisions, at senior leadership in terms of what we strategically invest in to support public health? And there are kind of like 3 areas we can look at, broadly speaking, and they're imperfect, but one is philanthropy, the second is federal, and the third is state. And these are actually huge, huge dollar sources, right? When you kind of start to look at them strategically. The state budget, I want to give a lot of credit to Chris Mulick. In the past 10 years, we have more than doubled our state appropriation. The state of Washington is very generous with higher education. They have prioritized higher education. Governor Inslee has prioritized higher education. We are really generous with respect to student financial aid. And so that is something that we want to take really seriously and have an ongoing conversation with the state about. Now, one thing I want to say, which is different for state versus federal or philanthropy, is the state cares a lot about education. They care about workforce development, and how we are going to touch communities. So that's one of the lenses that we look at when we talk about state funding. So over the past year, so one thing that was identified last year, for example, was inequity with respect to nursing salaries, particularly as they were heading into accreditation. And it was really helpful that this group identified that. We were not able to look at it in the supplemental, but it was some of the fodder that gave us information for the supplemental. I offer that to say we are heading into a biennial budget. The supplemental budget, it's the queen of the budget process. And so in Washington State, even though the legislature meets annually, the budget is really done biennially. And so for WSU and the biennial, Chris, it's over $1 billion? Is it, what are we, 550 million per biennium?
Oh, yes, a little north of that.
A little bit north of 550 million. So a lot of dollars on the table that we are talking about. And that's just our base budget. So we always ask for our base budget. We also ask for a percentage change, which I'll talk about in a second. And then we are able to ask for strategic priorities. Because of the work that was done by this group and in partnership with my colleague, Vice President DeWald, our entire legislative agenda is going to reflect our interests in public health. So I'm going to hand those over to Chris to talk about our decision packages, but I do want to talk about the first one, which is compensation. So our number one ask at Washington State University for the decade that I've been here has been compensation. And we ask for that. We take it very seriously. It's been really hard to get after because of decisions that we made in the recession. It takes a little bit of time to go into that, so I'm not going to go totally into that. But what happened is that we have a funding formula with the state that has not allowed us to fully fund pay increases. And I think we all know and understand what that looks like in colleges, in departments, on campuses. So we are prioritizing that. We are going to ask for both compensation for pay increases, but we are also going to go after the formula. While that one is not specific to the work we are talking about with respect to public health, for any community, we also know that that will allow us to do all of the things we do at WSU, including making strategic investments within departments and units if we are able to address the funding formula. So that's the first one. The second piece is there are 3 of them are with respect to nursing. Again, Chris will talk about that, social work, and then public health degrees. So I'm going to hand it over to Chris because we only have about 15 minutes, but I'm happy to take any questions. And I look forward to our work together as we go into a legislative environment over the next, I would say, almost year, really. Okay.
Great, thank you. So I'll try to go fast here and not bury the lead and just talk about some of the disciplines that we are going to pursue here. So Colleen mentioned nursing. We've got an urgent need for a plus up for the College of Nursing across the state, recognizing they've got a reaccreditation visit. And our challenges there have become more acute here over the last several years. So we're going to ask, you may recall that the university announced that we were providing some one-time funding in order to bring salaries from 25th percentile of nurses relative to nurses with similar degrees to up to 50%. We're going to ask the state to firm that up. So that the university doesn't have to go look for those funds to backfill on a permanent basis. So that's going to be a big one for us. In terms of new academic programming, we are going to be pursuing a 4+1 bachelor's and master's in social work that we would locate at the Tri-Cities campus. This one is still being developed before we push the button and send it to Olympia. We have done a little bit of work in the spring and summer, just kind of testing the waters. I think it's intuitively known that we need more social workers in our state. And so we're going to give this a shot. We obviously don't have a program at WSU, and we'll be new players to this. That's certainly locating the Tri-Cities where they've already have some internal resources to devote to this. It is a location where it's a bit of a distance between that and the nearest social work program. So we're looking forward to working on that. And then Colleen mentioned public health. We'll call it a bachelor's of science in public health. It won't look like what you see in other programs in the state. We'll have 2 majors, one in infectious disease, which we would locate if funded in Pullman, and then a major in behavioral health with an emphasis on addiction science, which would be located in Spokane and Vancouver. Now, so those are the kind of the 3 items. I'm going to put that under the auspices of new stuff, right? Colleen mentioned compensation, and I also want to mention some of our other maintenance level asks. So I know we have some folks here from Ruckelshaus. We've been asked to submit something to provide some base funding for the Ruckelshaus Center, which operates on a pretty, I'm going to say somewhat volatile funding stream. We've also got a maintenance and operation requests for new buildings, one in Vancouver and a new water tower in Pullman, super exciting. But these are important because when we see revenue growth at the state level, which is now really starting to flatten, and you see, look, they're going to have more money next biennium than they had this biennium. One of the things you got to remember is a certain portion of that is going to come right off the top for maintenance level costs such as these. There's also bow wave effects from investments that they previously made that costed X amount when they made them, but in the next biennium they cost Y amount. Some of the things that we have asked for previously And some of the things we are asking for now will have a similar effect in future biennia. And then the big one is compensation. There is a more earnest effort being made than I've seen in our 11 years around compensation, because inflation is once again a real thing. People get it. And we don't want to talk the legislature out of that. It affects you, your colleague, and all of the people that we all rely on, and we really need to get that fixed. We have a funding formula issue for public four-year higher education that we've got to get fixed. Spoiler alert, we're not going to be able to match inflation. Compensation, even at what appear to be really modest levels, is really, really expensive, but it's really, really important. And so that's gonna be a real big priority for us. So with that, I'll stop talking, and we're happy to entertain any questions or conversation. My name is Chris Mulick. I'm the Senior Director of State Relations for WSU.
I was just going to say a couple of additional things with respect to compensation, social work, and public health, really social work. So a few things. First of all, we don't have slides because this is truly a preview. Some of you may have noticed that the Regents had a special committee of the executive committee meet last week. So there has been a little bit of attention to that, but we have not actually submitted anything to OFM. That will happen in the next coming weeks. It doesn't actually happen until September. Once that happens, then there will be a story in the Insider, and we will have formal information about it. There will be an email that goes out from Provost Chilton, from Vice President Stacey Pearson, from myself, that will detail this information. The other thing that I will say is one of the things we heard loudly and very clearly last summer at the workshop was we need more faculty. We're already doing extraordinary work, but we really need more faculty. These programs will provide more faculty. So I want to be, state that in plain talk. So the social work program will be in the Tri-Cities. It will invest in faculty who do a social work program. The public health degrees will invest in faculty to support the areas that Chris talked about. And then obviously with compensation, if we are fully funded or even make a significant improvement on the funding formula from the state, that will allow us to invest in faculty in the areas that we at WSU that have identified through various strategic plans are priorities for us and allow us to support that work. So everything that we have done this year supports the work that we have all been doing together and really what we have done for you. With that, I am more than happy and would love to take questions. Getney, that's good too. Hi, Alex. So Alex asked what the percentage is for compensation. So what we presented to the Regents last week, and part of the reason that I was saying this, we don't have slides and we don't have an insider story, is because we presented a range. Part of what we are wanting to do with respect to the percentage increase is we are working with a whole number of state stakeholders who are looking at what their percentage increase will be, probably 3%. So what we said to the Regents, we would be asking for anywhere between $20 and $45 million for compensation. That's a pretty big range, but the idea is that we correct the underlying formula. So that just allows us to actually have the state pay for our compensation and not have tuition pay for it, because that's what happens right now. And then on top of that, we are asking for an actual raise. We don't have the numbers yet. Does that make sense? I have to be honest, the formula is one of the hardest things to explain. And it's, I think, just the challenge of explaining that even to policymakers is one of the things that has made it difficult to completely improve it. I also want to thank the legislature and Governor Inslee, because we made a huge improvement last year. So what we're going after this year is just to continue on the work that they've already done. Other question? No? All right. I really appreciate all of you. We thank you for your work, and it makes it easy for us to bring forward these asks because we know that we have stakeholders and we have faculty and we have students who support it. So if you have any questions, please reach out to me. We have a webpage. Patty will provide our email and other contact information. Thanks, Celestine.
Thank you, Colleen and Chris, for giving us that preview, especially the preview since it's not out yet. Next up, we have Dr. Ofer Amram and Dr. Julie Postma over Zoom. Dr. Solma Zamiri is the Zoom moderator, and the topic of this next presentation is environmental public health.
Hi, everyone. Thank you so much, really, for giving me the opportunity, Celestina, to talk about environmental health research at WSU. I think this presentation is going to be a little bit of a different format, only because, as you know, we don't really have an environmental health program here at WSU. We have an amazing research done by different researchers across the university. But saying that, I think this symposium actually can really advance environmental health research at WSU just because of that. Bringing together all those different researchers, and I think in a crucial time where we know that climate change is here, coming, and will be with us, for the foreseeable future. This type of research is crucial. So preparing for this presentation was great because I had to really learn about all the different type of research at WSU. And for me, that was just an eye opener about the sort of the different topics. And this slide can really give you an idea, just a very general idea about the different type of research done at WSU. There's a lot of research going into farm workers. A lot of this research is actually collaboration with Extension. We do a lot of research on green space exposure and mental health and health using the Twin Registry. I did quite a bit of research on pesticide exposure, but in recent time, there was naturally going to be a shift into sort of climate change type research, and that's I think what we're going to see in the coming future. But really learning the different type of research at WSU, I came to realize that most of it is actually done in the College of Nursing. Therefore, halfway through this presentation, I'm going to hand the mic to Dr. Julie Postman-Zoon, and she can talk about the research at the College of Nursing, and hopefully we can come back and then talk about all those objectives we want to achieve and how we want to do that. So the first few slides will talk about my research and research that I usually work in our lab. So during COVID-19, we really had to bring our research up quite fast and really think about research in a different way, as you know, produce things quickly, responding to the COVID-19. So we did a lot of work with multi-care, creating sort of modeling for hospital surge, creating some data visualization of the national level, looking at rural, urban differences and surge of growth of COVID-19, and also work around breast cancer screening post-COVID-19. Most of this work focus on health disparity and health equity. We also have a lot of funded work from NIH looking at exposure to the environment using really big data set. So looking using mobile data, so looking at exposure to green space, looking at how the environment impacts physical activity and how humans interact with the food environment, and looking at health outcomes. So we are hoping that in the near future, we can build on it and get more funding from NIH, advancing this type of work. We also do a lot of community-based research. Just an example here, this is work done by Dr. Solma Zamiri, looking at air quality and in Spokane elementary schools, and how air quality in those schools impacts absenteeism and inhaler use. So she basically took her work is to deploy air pollution monitors in schools, and over a 2-year period, and that was done during the COVID-19. And you can imagine the challenge with school closure around this time to do this type of research. But what she found that air pollution in school is directly related to absenteeism, but not so much to inhaler use. Moving forward, a lot of the research I'm focusing right now is actually looking at climate change and the impact of health on health. So just to give you an example, a study working right now is currently under review, looking at seasonal variation in cardiac mortality, where we know that colder weather impact essentially have direct correlation with cardiac mortality, but how this actually interacts with climate change. So looking over time, in the last 8 years when we know temperature increase, how this actually, all this interaction works together. That's a really interesting work. Looking forward to build on this. So during this work, we have a lot of collaboration, and I'm missing some logos here too. So do a lot of work, obviously locally with Spokane EMS, for example, Spokane Regional Health District, but also nationally and internationally, work in Canada and in Israel and so on and so forth. So collaboration for us is a key thing, because we want to get data from different places in the world when you look at the environment and assess the impact on public health. Now, with that, I kind of finished my part, and I'm going to let Julie. I don't know where she is.
Well, thank you for the opportunity to share 3 exemplars of our public health nursing research focused on environmental health. The purpose of the first study, which I now can't see, but that's okay, promoting risk reduction among young adults with asthma. Oh, thanks. You can, perfect. So
Julie, just tell me when to move the slides forward.
Okay. Was to examine the feasibility of a risk reduction smartphone app on asthma outcomes. So on the slide, you can see images of an app that we developed and tested in this feasibility study. It includes risk reduction measures, including the EPA SmokeSense app, portable spirometry monitoring, and data visualization, as well as a message board where participants could interact with each other. We conducted this study with 67 young adults in the Western US, and the goal was to help people with asthma decrease their exposure to wildfire smoke and maintain their asthma control. Next slide, please. Thanks. In terms of the participants' exposure to poor air quality during the study period, the orange box there, second from the left, illustrates that 8.5% of days exceeded the acceptable level of fine particulate matter under federal daily standards. The range was from 0 to 17%, and this is considered unhealthy for sensitive groups. And all of our participants had asthma, so that in and of itself is an important finding. Next slide, please. Thanks. We didn't see any group differences in airway narrowing or asthma control over time, but the study wasn't really powered to detect those differences as it was a feasibility study. That said, we had excellent compliance with regular use of portable spirometry among young adults, and that's that little gadget you see on the right. It's a handheld spirometer. And actually, we had 85% compliance among the group taking twice daily readings. And this was a research question we really needed to address for this more personalized approach to risk communication versus the more general reporting of air quality messaging. So next slide. Thanks. Findings might be related to intervention adherence and engagement, which I color-coded in this slide. We learned a lot from these young adults about what they liked and didn't like with the app. So participants were more engaged in identifying their air quality and their symptomatic response to wildfire smoke than in using the more generic educational features of the app. As I mentioned, there was really good compliance with spirometry, but low engagement with this message board. Participants overall found the app acceptable and offered strategy to improve engagement with the features, including the message board. And that's exactly why we tested it in a young adult population. Next slide, please. And one more. Our second kind of line of research in this area is around supporting agricultural workers during smoke and heat. So we wanted to understand worker perspectives and experiences during periods of heat and wildfire smoke in order to support protective workplace interventions. You can see that findings from interviews and focus groups in the fall of 2021 included a recognition that workplace conditions are increasingly hazardous. Workers feel a sense of replaceability. They report a need for employer education and training on rules and stronger enforcement of the rules. These echo concerns with what workers and growers have reported in California in many ways. And the implications of these findings, I think, are really best represented in this quote quote with the workers saying, I think the best thing is to train the supervisors. Many people say there's no point for us to learn how things work if we get no support at work. So these findings encouraged us to study Washington State ag employers. Next slide, please. And in this follow-up study, we're characterizing factors associated with the likelihood of agricultural employers taking actions to protect workers from wildfire smoke exposure. So these actions in terms of identifying poor air quality and communicating the hazard are in emergency rules from the state labor and industry that have been enacted. So we're checking in to see how that's going from both sides, really. We are conducting key informant interviews at this time, and we will be working with the WSU Extension's Ag WeatherNet system, our listserv, in order to survey employers. Just pictured here on the slide are locations of air quality monitors in our state. Some of the counties with the most ag workers have the fewest air quality monitors, and the density of the monitors is one element that may impact how employers decide to monitor and communicate that risk to employees. And shifting a little bit to my colleague Claire Richards' work. Next slide, please. She is interested in describing exposure of populations to concurrent power outages, extreme heat, and wildfire smoke in Washington. We know, of course, that California has had preventive power outages, and we're looking at the same possible reality here in Washington. So pictured here are the average electricity interruptions in minutes by county over time, with the left side highlighting temperatures above 90 and the right above 100. This too is a feasibility study. She found that it is feasible to use this particular data set to ascertain broad exposure to power outages and concurrent heat in Washington state, but the lack of geographic granularity and missing power outage data for counties with high heat frequency are really important limitations of this data. Her work has implications for disaster preparedness and emergency response, especially for people relying on medical equipment at home. I wanted to touch a little bit, and I think those are the end of our slides, unless you did have time, Ofer, to add the last few.
No, I think that I don't have anything to add in terms of my content in terms of research, but I think there are some questions that are actually really important when we talk about environmental health.
We can go to questions or yeah, we can go to questions. Let's do it.
Thank you, Julie and Ofer.
Thank you very much. We can open it up. Solmaz, I know you're also over Zoom. Are there any questions or comments in the chat there over Zoom?
Yeah, there is a question about well water contamination and if there are studies in the state looking at that and the health impacts of exposure to arsenic or uranium.
I have not done well water contamination studies for the last few years since the Butterfields retired. I had worked with Phil Butterfield on well water quality, but he's making wine now, so that time has passed.
Yeah, I personally know Ofer, your Parkinson's disease project included well water contamination.
Yeah, we did include a variable, but it wasn't really sort of a big objective of the study to look at water wells. So I'm hesitant to comment on that at this point. Thanks, yeah. John?
That Victor grant and the ongoing conversations we're having with PNNL about, but it's not a done deal. But
yeah, I think, and that might fit into sort of the bigger picture of environmental health research here at WSU. So again, I think with climate change coming, there's a lot of funding coming into it from NIH and other different funding agency, and I think we're really in a good position, at least in the Northwest here, to maybe create a center or something, and not just WSU, different other institution, maybe in Oregon and Idaho, that look at environmental health research in the context of climate change, because climate change doesn't know any borders, and we need to sort of think a little bit bigger when we talk about climate change research. And I think current data set, large data set on population health are critical when you talk about a research focus on climate health, because that can inform essentially what's going to happen, what is happening. Because I think there's so many things going on, and climate change can impact us slowly by changing climate, but also we'll have this burst of extreme weather event that can obviously cause havoc. So there's so many thinking goes into it, and really the only way to know how to even start tackling this in terms of public health is to have data, and really good data.
I was wondering, so I know a lot of this work is happening in which was a surprise to me too. It's awesome. So I was wondering though, climate change affects agriculture, food sources, and things like that. So I was wondering if there's anything happening, climate change in agriculture, ag department. Are there places for collaboration?
I believe there's some research going into it, but again.
But there's the Center for Environmental Research, Education, and Outreach in Pullman that is interdisciplinary across colleges. A lot of climate change work, a lot of water quality work, a lot of that kind of research. And I think a growth in research is really pulling together the resources from that group and your group. I've been wanting my students to take courses with you, but I think that's where Jenny Adams, there's a whole bunch of people in engineering doing that kind of work. I would think to address public health issues.
In prepping for this presentation, we had to at one point say, okay, what is a kind of climate or environmental health research? So we kind of said, okay, it needs to have some health outcomes, direct health outcome related to it in order for us to talk about it in this presentation. But you're right. I mean, we can incorporate so many different things when we talk about environmental health and climate change in general.
And in fact, I believe that climate change has a days-long symposium. I think that just occurred for all of WSU folks. So a lot of work going on there, and we can see a lot of point of intersection for human health. Elizabeth, go ahead.
I was just going to say, Extension had an in-person meeting in July, and the whole topic was climate science. So I don't know if that's what you mentioned, but yes.
Yeah, that's what
we're working on a number of related white papers as well.
Great. Yeah, Pilar.
Yeah, well, obviously there's a lot of overlap between environmental health and infectious diseases. And I wanted to ask you, apart from climate change, another component of global health is land use change, and how that can impact. Well, we're focusing on spillover interfaces, but how humans interact with that. And I was wondering if there's any research.
Not that I know of, and I don't think in the land use context that you're thinking. I do a lot of gentrification stuff, so it's a different land use.
No, I was saying,
but
in
not that I know.
communities, conversion, for example, in rural areas from well, I mean, depending on where you're. I'm working on developing countries mostly, but you can translate it into agricultural ecosystems where you're changing crops and humans are modifying the environment and how you produce land.
Yeah, I don't know that there is, but somebody approached me on that because I do a lot of sort of satellite imaging analysis, and I think that would fit perfectly for that. So I'll be happy to work with them.
So while Idaho has gotten a bad rap in a couple of these presentations, I thought I'd also mention they have the Center for Health and the Environment that they put together a workshop every year that about half the people there are WSU faculty. And we had a joint proposal that we put into the CDC looking at wildfire and its impact on vector populations, because you burn up a forest, you burn up the ticks inside the forest too. So there is some work there as well. But
yeah, that might fit the PNNL.
Yeah, PNNL, Pacific National Northwest Lab, has probably the best omics capacity in the world, certainly right up some of it. So it's a great partner for some of this, I think.
think there's just so many unknowns that I think we really do need to have access to excellent data to just understand. In collaboration with different institution in Washington State.
Yeah, absolutely. Taking some of the great science centers that we have here and linking it to human health, I think is going to be key. Any additional comments, Solmaz, over Zoom, or Julie, anything to raise to the group?
Celestina, there is a comment at the Center for Sustaining Agriculture and Natural Resources. They are gathering data on climate impacts farm workers. That's like a collaboration opportunity for people who are interested. Yeah.
Perfect, thank you. And I know in Courtney's talk, one of the comments was the link, I think over Zoom, the link between infant, maternal, and family health, and also environmental health as well. So there's a lot of intersection here. Anything else from the room here? Okay, great, thank you. Thanks, Ofer. Thanks, Julie. We're gonna head right into our next one on nutrition and food systems. We have Dr. Kevin Murphy. Kevin, good to see you in person. And the Zoom moderator there is Patrick Silverson.
Good afternoon, everybody. I've been watching these presentations with a lot of great interest today and taking lots of notes, but I've also been watching them with a little bit of chagrin too. I don't know if you all have noticed, but they are all formatted the same way, and apparently there was some template we were supposed to use. Celestina, I apologize. I'm not very good at taking directions. If that backfires, then Eric, I might be applying for your postdoc, which I'm totally unqualified for. So my name is Kevin Murphy. I'm an associate professor in the Department of Crop and Soil Sciences. And I just want to talk about this work we've been doing for the last 7-8 years or so, where we're trying to improve human health and nutrition, but from what we call a soil to society perspective. So I'll get into what that means here, or what we're doing. And so just kind of an overview of what I'd like to talk about today. A lot of time spent just focusing on some gaps that I think we can identify and talk about and move forward with together, some of the assets we've been doing, and then really some opportunities for collaboration too. So I'll start with what we do, which is crop biofortification in the context of a soil to society framework. And then these are some of the opportunities or gaps that I'd like to address too. So we've got crop diversification, education, both high school, undergrad, graduate, that we're working on quite a bit with extension, and then the idea of just more international collaborations as well. So I may say biofortification a lot, so I just want to share what that means to us, and that's using plant breeding, using technology, biotechnology, using agronomic practices, cropping systems, all those kind of things, kind of integrating all those to develop varieties of crops that are really more nutritious or more heart healthy, things like that. And then also biofortification refers to food too. So these crops can then be used in foods that are also biofortified. And I'll give an example too. So I'll start with barley. This is a picture of Megsong barley. And how many of y'all have eaten barley in your life? A lot, great. So I'm guessing most of the barley y'all have eaten, because it's what you buy in the store, is called pearled barley, right? So so barley has a hull, and it's very tightly adhered. It's essentially glued to the seed, to the grain, and to get that hull off, which you don't want to eat, it's not tasty, you have to pearl it. So we pearl it, and that removes the pericarp of the seed, and where the pericarp is, that's where all the micronutrients are, for example. So when we pearl it, it's no longer a whole grain, and it's less nutritious. So this Megsong barley is a naked barley. It's another term we use for hulless barley. So we bred a hulless barley variety. It is much richer in micronutrients than the pearled barley you buy in the store. Also, this is interesting, that pearl barley you buy in the store is either barley that has been bred for animals, which is fine, but that's what it is, or it's a failed malt barley. And So failed malt barley varieties, we breed for very low beta glucan content, very low. In this food barley that we did release, we have a couple of these out. We are aiming for high beta glucan barley. So the feed barley may be 4%, malt barley 2 to 3%. This Megsong barley is about 8% beta glucan. So you can get an idea of just the percents we're talking about. This is a picture of it in the field. And I'll start just with acknowledging Meg Galnick, who this variety is named after. She works in schools a lot in Pullman, works with kids, community gardens, amazing person. So this barley we developed with the help of chefs, and quite a few chefs gave their input. So we have like dozens of breeding lines. We give them to the chefs. They tell us which ones they like. Megsong came out of that. This is Daniela Soto Inez. She's a chef in New York City. Worked with Megsong barley, as did many. This one was featured in Bon Appetit magazine. This barley has been picked up by Row 7 Seeds. It's being pilot tested this summer in 20 different locations in the East as kind of like the barley version of chicken nuggets. If it works well, this is with a large company, then they'll have it in 2,000 stores this fall. So this is just one example of a variety, a biofortified variety that we've released that gets out to the public. So then the question is, what health impacts does this have, if any? So this is where we get, I'll show this slide kind of as we go along, but to some of the opportunities. So one thing we're trying to do, we've been working on for a few years, is building this pipeline between agricultural and health scientists. And what we want is the outcomes from this pipeline, from the clinical trials or other trials that the health science do, to inform what we do and give us targets to shoot for in our breeding program. And this is where essentially, so this strategic reallocation project led by Dr. Keene, what started about the time we released Megsong barley, and this is really gave us a perfect opportunity to explore this collaboration better. Along with John Roll, Glenn Duncan, Shelley McGuire, Guy Palmer, and myself, we just led this project. It came out of Connors, but it was very multidisciplinary. And the idea was to just figure out how to build bridges, what we're talking about, between Connors and College of Medicine. So we got about $2.5 million for this. This funded pilot studies, several of those. It also funded 3 faculty positions, 2 in the College of Medicine in the Department of Nutrition and Exercise Physiology. One of those is our moderator, Patrick Salverson. So, okay, so we've got the pipeline I mentioned that we're trying to do. So we've got breeding, agronomy, soil science. We select for nutrition, nutritional traits as we go, and barley, especially with micronutrients and beta glucan. And then we get evaluations from chefs, flavors, all that. And this is what we actually did to release. Now we're starting to do things differently. And that is adding in the human health component. So this was a student of mine, a master's and then a PhD student, Julianne Kellogg, who worked with Martin Pidi Perigri and Pablo Monsevis. Pablo was here earlier in NEP, and they developed this project to test. So that question of whether or not 8% beta glucan actually has an impact on cardiovascular biomarkers or not, or is 4% enough and we're just wasting our time? Do we need 12%? So that was kind of the question they're asking. And that bottom arrow that just showed up, that's really important because this is very rare in the plant breeding world. We almost never get any feedback from health researchers on what our target should be. So that's really exciting, kind of what we're doing here and showing barley. And this is only slide I'll show with any kind of data on it. This is from Julianne's dissertation, so not yet published in a journal, but we're just looking at blood glucose over time. And this was in a number of participants who would eat all the different, would eat a high beta glucan, a medium, and a low beta glucan barley, and then a white rice also, and then appetite, satiety, and blood glucose and other response variables were measured. So I'll just show you this bottom one here, the unsweetened barley. And if you look at anywhere between 15 and 45 minutes, you can see that there are major differences across these varieties. And so this, we don't need to dwell on this. This is just an example of, this is from a pilot study from the Grand Challenges. And this is what we're looking to do on a much larger scale. And so as we build these bridges, we have to get more funding for this. And the first and a major grant we got was the Foundation for Food and Agriculture Research. They're very keen on this type of work. So we may go back to them as well, but we focused this one on quinoa. And so our PIs, we have a soil scientist, a plant breeder, Irish Gangel is a food scientist, and then Frank Carbonero is a gut microbiome researcher who is another one of the new faculty hired through the Grand Challenges grant. And then we have industry partners because we want these varieties that we release in food products to become adopted. So we spend a lot of time with industry. This is a photo of our quinoa trials from this year that shows our soil fertility trials, our breeding plots, all that. And like the barley pipeline, we've developed this quinoa pipeline where we do very similar research, but now here Frank is going to be focusing on the impact of different varieties and then different food products on the human gut microbiome. So that's exciting. The next opportunity really is crop diversification. Washington State is the second most diverse crop in the country behind second most diverse in terms of agricultural crops and livestock in the country behind California. And with crop diversification, so we already have a lot, but I'm talking here research. We need to diversify our research. A lot of these crops are underutilized or under-researched, and it's time we focused on those. And that'll allow us to expand the number and the breadth of our nutritional traits that we focus on as plant breeders. So to do that, we just received another grant. This is the end of our first year, and it's very similar to the quinoa grant that I showed you, but instead we're also working on barley, wheat, peas, lentils, buckwheat, and quinoa again. So we're starting to diversify that, but you can kind of see a trend here. They're either grain legumes or whole grains. So we can diversify beyond this. We can go to fruits and vegetables and all this, and that's something we need to do. But right now we're still establishing these pipelines and getting to know how we speak to, well, as a plant breeder, how do I talk to Pablo? How do I talk to Frank or any of these human health researchers? So we're spending a lot of time doing that. These are the PIs on the grant. You can see there's several from Connors, the College of Medicine, USDA, Johns Hopkins is involved, and Viva Farms as well. And our goals are, so as we release these new varieties and foods, they still have to be affordable and accessible to the public. That's really important. And we do this through developing biofortified varieties and biofortified products, and then deploying these to consumers in a broader way as we can. And so a lot of us are working on that. I just added this because everyone else had it, so I added it today. So there we go. So this is our version of actually it's very similar. So let's see, so we've got our work here in plant breeding and cropping systems and how that overlaps with diet and human health sustainability. And so food productions, we are working with Johns Hopkins and Pablo Monsivis on population health impacts as we do increase the nutritional value of these. And then economic and social sustainability is a really key part of our work too. And you can see kind of around that education, outreach, and extension. Those are huge components of what we're doing. So I'll talk a little bit about those too. So here again are just different project components that we are focusing on. And there were some photo slides of people today. So just want to share our folks. These are our the agricultural team that we're working on. We can expand this. We would love to expand this, but this is who we have so far. These are our food science team. Steve Jones here at the bottom kind of fills both roles. He's also a plant breeder, but it runs the bread lab. Juming, Tang, and Garish are involved. And then here's our the team we work with in NEP as well, and John Roll too. John's an advisor on this project too. So I want to highlight Anna Warner. She is an education person, so that this is one of the main gaps that we have that I want to share with you, and maybe something we can think about. A lot of us teach courses, and so how can we incorporate this multidisciplinary work into courses that we teach? And then this is Vicki McCracken. So again, a lot of us on this project do a lot of outreach, extension. I forget who mentioned that they did 58,000 or 68,000 miles on the road. That's impressive. Some of us, let's see, like Garish, he probably comes close to that. He does a lot of food science extension. Clark Neely doesn't have a day in June where he's not doing field days. And so Vicki is the Associate Dean of Extension in Connors, and we work very closely with her on trying to develop and do more than we are doing already on extension. So I'll start with the, just briefly, the education component here. And these are students, these are graduate students who are working directly on this project, either in many different crops and in many different ways, but they're all being trained multidisciplinary between agriculture, some health sciences, some food sciences to different extents. So that's what we're trying to do. There's another whole cohort of 6 to 8 students coming in well, right now this semester. So their photos are on here. And these are so what we found is it's these students who are really helping. The faculty are so crazily busy, we can't do a whole lot. So these students are the ones who really help build the bridges here. And so that's exciting. And they just have so many great ideas, and they love taking courses from College of Medicine. And so we're doing a lot of that on the graduate level. And then on the undergraduate level, Glenn Duncan came to me, I don't know, 10 months ago and said, we really need to focus, see if we can develop a new major. So Pablo Montevis and Holly Henning are really helping with this. And our Associate Dean of Academic Programs, Nancy Derringer, she's the new interim dean there, is really excited about this. So what we're trying to do now is develop a new degree program and major at WSU that trains undergraduate students in agriculture, food systems, and human health. And so we're not sure when this will start, but we've got a good start on that. So that's something we're hoping to unveil in the next year or so. Extension. So this is another really important area that I think we need to focus on, and would love some feedback and kind of ideas of how we can do this, because even though we do a lot of outreach, there's a lot more that we can do, including working more with tribes and especially the underserved communities. So we do a lot of work with Viva Farm. So much of the work we do is translated from Spanish to English in field days and publications, things like that. But there's so much more, I think, that can happen for other underserved communities as well. These are just, we want to be in every county if we can. And WSU has a phenomenal extension system, and if we can incorporate this work, and it'll probably look different in every county because the crops are different and all that. But with this framework we've developed, I think we can start to do that. So if anybody is from any of these counties or just wants to reach out, this would be a great place to start as well. Okay, finally, just want to share that a lot of us do international research too, and there are. So we do a lot of field trials in many different countries, and the gap there is we don't have the capacity really within all these countries to do the health science or nutritional work. Bringing it back here to WSU can sometimes work, but also sometimes a little tricky, can overwhelm our collaborators in that. And so, but yeah, I just wanted to share one of the things we've recently done, gotten funding for from the Rockefeller Foundation, is this periodic table of food initiative. And so they're funding us to, take the work we're already doing, all these field trials, and then they're paying for a lot of like proteomics, metabolomics, even lipidomics research that we're doing on all these crops, how they're grown in the soil, what the soil health is like, what the different varieties, and so that's really exciting. These are on the bottom. Let's see, we've got our work in Rwanda, and then this is in Kenya. This is in Malawi and back to Rwanda. This is my Cedric Habiyaremye. He was a master's PhD and now postdoc in my lab, and he runs a lot of our African programs. So this is, again, just a synopsis of all the gaps, opportunities I've talked about. And my last slide, just wanted to, first of all, just share my email. So please do reach out if there's any interest at all in any of this. Love to chat with you. We've got a great team too, so it doesn't have to be just me. I'll we can point you in the right direction too. And then just questions to consider. I think somebody called them like starting points for questions earlier today, but yeah, really curious if you can think of any additional gaps. I know there's a lot, but and then ideas for filling these gaps, and then we are looking for more partnerships. So the funding we've gotten is just a beginning. I think we've got a long way to go here. I think a lot more research can be done and funded. The USDA is very excited about this type of research and offering more funding every year. And I think it's easier than all these NIH grants, which I have no idea how they work, but I hear they're hard to get. Okay, so that's yeah.
Over to Patrick over Zoom and see if there's any questions or comments from our Zoom participants.
Hello. Hey, Kevin, can you hear me okay?
Yeah, Patrick, we can hear you perfectly.
Wonderful. Well, over here on the Zoom channels, Kevin, you did such a wonderful job introducing such a broad pipeline that you stunned them into silence. But if you want, we can kill some time talking about those barley chicken nuggets. I'm very
So talking about crop diversification, Patrick works on elderberries, and in his backyard he has an elderberry nursery also. So there's a lot we can.
18 and counting.
What about in the room? Oh, yes, Sterling.
Yeah. Hey, I'm Sterling Pearson, College of Medicine. That was a really fantastic talk. Thank you for that. My question was going to be about how students are involved in your work, but then you answered that question. But then your extension slide made me want to ask, with this new major, is there a way to get the students exposed to all of the affiliations you have with extension? Is that part of their experience during the major? I know there's complications with that because they're undergrads and they're taking courses, but has that been part of the thought process? It seems like that might help with some of what you talked about, I think near the beginning, around how it's pretty rare to have this bi-directional communication between health scientists and plant breeders like yourself, right?
That's a great question, and in our discussion so far, we have not even talked about that. So that's a great idea. I will bring that to the attention because we're developing this now. It's something that could fit in. We have internships as part of this program. This is probably, well, yeah. So we have internships, and then we also have a capstone course. So maybe either of those could be. But in terms of specific coursework, I'm not sure. But maybe we could figure out how to do that through an internship or capstone project or coursework somehow. That's a great idea. So yeah, thanks for that. Tom?
Kevin, first of all, that was awesome. It was really interesting.
Formatting was okay.
I didn't even notice that it was a formatting difference until I saw something about the drive to 25. So I'm going to hold you personally responsible if that comes back. The question I had, and this might not be the right place, is it's a conversation that keeps coming up in our household. It's about the crop diversification in the sense of getting away from monoculture crops. Is that something that you look at, the impact of these huge monoculture, what that does to the disease resistance and things like that, but also impact on environment ecology?
That's a great question. I'm not sure if anyone from the Grain Commission is here, but we do look at that because, you know, it's a blanket of 2 million acres of wheat we live in with a few other crops thrown in, but not much. So there's different kinds of diversity we're looking at. And one of the most exciting diversity things we're looking at, which relates to climate change in a very strong way, it's why we're doing it, is intraspecific diversity. So we have this evolutionary breeding program where we provide a functional type of diversity of a crop to farmers in a field. And this started, you know, farmers aren't new to this. They mix varieties and put 2 or 3 out there of wheat because they have different disease resistances and all that. But the way we do it is a little different, where there's actually, instead of 2 or 3 varieties, there's hundreds or even thousands of different unique genotypes in a field. It has to be functionally diverse, so they can't be wildly different. They have to be same market class, same maturity, but that type of diversity is something we're really focusing on in several different crops. And then the whole, so I did my PhD in wheat breeding, and then I was barley breeder for 8 years, and now I'm focusing on what farmers have identified as potentially important rotational crops for them to include with the other grains that you see. So millets, buckwheat, quinoa, spelt perennial grains, some different types of barley. So so anyway, we're addressing it that way, but that's, I think, one of the most important things we do need to think about. And farmers are very interested in that. It's a slow process. It's hard to replace some of the dominant crops, but as a state as a whole, we're very diverse, but there are, you know, parts of the state where we're not, and it's not because of farmer lack of interest. So these underutilized crops, just, they don't have enough research behind them to get them off the ground in a lot of cases. So that's what we're shooting for, and that's another gap. We actually need more. I mean, the ones I'm working on, we need more people working on these types of alternative crops also.
Yeah, I think Eric mentioned University of Idaho, and they have like this workshop that a lot of us are participating on, particularly like vector-borne diseases. But there's a lot of people working on vector-borne diseases of plants that are participating on that. And one thing that comes back all the time is kind of the overlap between vector-borne diseases that affect humans and plants, and how maybe like focusing on one might have counterintuitive effects on the other one. So for example, like focusing on reducing the burden on vector-borne diseases of plants using pesticides can affect also insecticide resistance and other vectors of like human diseases. So I was wondering if that is something that you like, because one of the things that it's always comes back is to monocultures and the use of pesticides and all that. So I was wondering if that was part of your research, if there's any interest in that.
There's a lot of interest in that, and so a lot of our students are taking courses in the College of Arts and Sciences from their evolutionary ecologists, taking these ecology courses and integrating that into their research, because it's critical. So there's a lot of student interest in that. It's not part of my research, but it's definitely growing and really important, and a lot of people realize the importance of that. So yeah, John, you had a question.
I love this stuff, Kevin. Great job. One thing that I think we got really slowed down on with COVID was looking for common touch points between this work and the work John Oatley and folks do with animal-derived nutrients. And we've met with Brenda a few times about this, but I think there are some real synergies that we can capture if you think about how does this line up plant-based nutrition with protein-based nutrition.
Yeah.
I'd love to see us
And
keep pushing.
as you know, yeah, we were moving along before COVID hit, and then I think we
Take complete responsibility for that one.
for COVID.
Not for COVID.
I was wondering, I know this is talked about in infectious disease more, but is One Health still a kind of a approach or topic that, your group talks about or frames their work within?
So the question was, do we still talk about, or does One Health fit within our framework? I'm not really, yeah, we don't talk about it a whole lot, but I would love to hear Colleen's response to that. Just, yeah, I'm not sure what the status of the whole One Health.
Question, I heard part of it.
Oh, just several years ago, I had worked with a group through Connors and the vet school on One Health, which is like a framework to think about how shared environment affects the health of animals and humans. And, it's just kind of a framework. And I think it's talked about in infectious disease circles as a big deal these days. And I was just wondering, is that a unifying framework that people in USDA or INEAX would kind of talk about in terms of nutrition?
I think more and more, the word was thrown out for a number of years. You would see One Health put into people's proposals, but then it was just kind of the same thing, but trying to stick the new name on there. I'd say in the last 2 or 3 years, it's actually gained real traction. People are actually seeing real impacts in that area.
Tom?
Yeah.
Do you think that is, so there was a meeting we talked about, and Paul Whitney, where is Paul? Is Paul still here? He's one of the people, or Doug is one of the people who could probably speak to this, but we did have this meeting here in 2014, and it was one of the big takeaways. When we did Chris Keene is here, the grand challenges, One Health was one of the things that we talked about as an overarching framework. My understanding is it's one of the reasons that we started to change the name of the Allen School from Global Animal Health to Global Health, is because we really are kind of looking at the full continuum. I think that to the point that John Roll was making with respect to the work that John Oatley is doing and Kevin Murphy, that's also part of that. Your question is a good reminder for us that we need to use that language again and maybe be more specific about it. I will also say our colleagues are here from the Department of Health, the Washington State Department of Health, and Dean Borgeson led a roundtable conversation with them yesterday. And as they are looking at their strategic plan, that's one of the organizing principles that they have as a state. And it's a good match for us. And it's one that we've talked about for so long that we have become latent and probably need to be more direct about that.
Yeah.
Does that
Well,
resonate?
And we certainly in the discussions about public health
Absolutely.
at WSU, we've used that term One Health as really being sort of much of the groundwork for that.
Yeah, I mean, my last impression is when we have been in Kenya or in Tanzania or meeting with some of the NGOs in Europe, they use it much more readily. And we're using it maybe a decade ago, stopped using it, and it sounds like now we're starting to use it again. So it's good for us to revisit. And I don't know if Laura Lockhart is still on, but it's a conversation I will look forward to having with her.
You got it.
Do we have to go? No, I saw Eric had his.
So solidarity for someone else who didn't format their slides the same. You had mentioned sort of slow processes in terms of getting some of these crops turned over, but a lot of your health outcomes are slow processes too. If you're talking about blood glucose levels, you're talking about the development of diabetes or heart disease, something like that. And grew up eating barley chicken nuggets is a long question to see what that has. So what are sort of some of the ways that you think you might be able to sustain being able to follow those questions for a long time? Because I think one of the things I've countered in nutrition science generally, which is like canonically, like your first epi class, you learn about folate fortification, and that like just solves neurotoxic defects. But one of the things that nutritional epi has always struggled with is, it's really hard to show things on 5-year grant timelines.
Yeah.
And so my question is there sort of a sustainable model to try to follow the impacts of some of these things as they relate to sort of tangible health outcomes for people?
Yeah, that might be the most important gap we haven't addressed yet. And so plant breeding is a very slow process, 10 years to get a new variety. This, what you're talking about, also very slow. So everything we're doing, we're planning to do long term, but you're right, we're on these 5-year grant cycles. This SAS grant that we got, we're hoping to just keep, but we're hoping just to keep getting it because it's a significant amount of money. John's laughing, but we are going to keep getting it if it's offered. But yeah, no, we just need to. So I guess, yeah, the team we've developed, we all recognize that we need to do a lot more, and the agricultural scientists, I showed just a few who a lot of the breeders, agronomists are very, very excited about this, very excited to work with the faculty we've started working with already, but it's so easy to overwhelm them. I mean, we have dozens or hundreds of varieties and food products and all this. I mean, so part of what we're doing is reaching out. So that's why we included Johns Hopkins as well. We're working with Colorado State. We're working with some private industry too. But I think everybody on our team recognizes how important it is to keep this going long term, because this is not in any way a short term project. If we end in 5 years, there's not a whole lot we can take away from it. So we do not have a long term funding plan. But I think Colleen's going to make that happen for us, right? Perfect. Thanks.
I really want to answer this question. This is one of my pet topics. Linda and I talk about it all the time. So Tom and Eric and those of us who've been working on Deep Vision, Daryl hears me say this, we get 5-year, 10-year grants from the federal government. What I want us to start doing, it causes anxiety. Tom probably is going to seize up when I say this. I want us to talk about year 6 and year 11 right up front with our partners, because one of the things that we learned through Deep Vision as we look on Davis is, they had the 5-year grants and then they have science that is incomplete. And so we are talking with them now about how we can complete that. But when we have state and federal policymakers, that's how you shape policy, is we are talking with them about what happens on year 6, what happens on year 11, what is the long, how do we track the science over the long term, but so we do that, we're actually shaping policy. And I think that's where Linda and I and Chris and I can be helpful in being thought partners with you internally at WSU, and then coordinating and connecting with our stakeholders. But that's one of my favorite questions.
You also have Dr. Pablo Mosias, a card-carrying
Oh, he came back. Good.
nutritional epidemiologist over there.
Yes.
So we do have some pretty expert insight into your question too.
So just a great talk, Kevin, and I love all the collaboration as you're developing crops and then you're testing for health outcomes and biomarkers. Because we're looking at underserved populations and rural populations, are you at a point where you're considering what the populations are that you are testing particular crop effects on?
I love this question because Pablo can answer it.
I thought so.
Yeah. Or Pablo, can you answer it? Can you at least address it?
Well, sorry, Daryl, I guess the question is it more about the types of outcomes that we evaluate?
Or about the population. So you're beginning,
Yeah.
it's really important.
Well, it connects to, I think, what Eric was raising. Let me stand up so everybody can hear a bit better. But I think that is a perennial question in nutrition epidemiology and chronic disease epidemiology, is the outcomes take so long to progress. So one way to get around that is you focus on the vulnerable population with higher risk of the condition, and then your time scale is suddenly compressed. But also, Eric, to answer your question, a lot of the initial studies that are planned, and Patrick can also talk about this, is we're really looking at kind of intermediate endpoints. So things that are metabolic or cardiovascular markers that have to do with longer term cardiovascular risk. And that's kind of that is what we're forced into in these kind of 5-year timeframes. But yeah, high risk populations would be a real focus in the long term. I think right now, many of the studies that are currently dialed into the grant are more based on, they're kind of more proof of concept projects, but I think in the long term, that would be the direction, is more vulnerable populations.
Any other discussion here in the room? Patrick, anything over Zoom?
Nothing coming from the chats, but I will make a comment based on what Pablo said, which is, yeah, a lot of right now is proof of concept, and we do within the department we complement each other well. In that, I'm an experimentalist from cells to rodents to human clinical trials, and then that anchors onto what Pablo's doing at the epidemiological level. So maybe I felt the need to make a comment because someone snarked a little bit about nutritional science, but there's proof of concept and utility in there, don't you worry.
Great. Thank you so much, Patrick. Thank you, Kevin. Excellent. Thank you so much. Take a 10-minute break. Sorry, Patrick. And then we're going to end with this fantastic presentation on tribal health. So see you all in 10 minutes.
Well, good afternoon, everyone. This is the last presentation for the day. And in opening, I'd like to acknowledge Dr. Naomi Bender's land acknowledgement and just remind ourselves that this has always been a place of learning, knowledge, and instruction, long before these brick buildings went up. And hopefully at the end of this, we can have a facilitated discussion where we have all of these projects discussed, where we enhance our learning, knowledge, and hopefully facilitate the instruction of learning of future generations to come. So with that, I wanted to start by mentioning that I had the task of finding out what goes on in tribal health at WSU. And that involved consulting with a lot of different parties. And I just wanted to acknowledge the different projects that I present are a result of a consultation process. We actually, Professor Sinclair and myself developed a table for which different faculty could list the different research activities that are going on. And here are the different people that we heard from Extension, from College of Medicine, from Office of Tribal Relations, and others. And I just wanted to acknowledge that work that has gone into this. And so first, I just wanted to provide an overview of what this consultation process resulted in terms of different projects and types. And I haven't listed everything under each, but I wanted to mention those up front that involved extension as well as were tribally driven. And I think it's important to mention a project on type 2 diabetes, which is NICSTUN. This is Dr. Sinclair. It's a culturally tailored intervention to prevent diabetes in American Indian men. It's a Native American Research Center for Health, which is tribally operated, which means that this is actually the Colville tribe that submitted this grant and is the grantee, and WSU is a sub. And I think it's important to point out that dynamic. Under substance use, we heard about that earlier today from Dr. Roll. I just want to acknowledge Michael McDonald as well, but this is the W Center for Rural Opioid Prevention, Treatment, and Recovery, and that's supported by SAMHSA. In behavioral health, Extension is doing a lot of good work. Emotional regulation for youth with toolkits, and that's the Clinical Family Research Unit at WSU Extension. I also wanted to mention hypertension management and health hearts among Pacific Islanders. That's Dr. Sinclair as well. Additionally, and I will get to this more when I talk about iReach, but there are several parties at WSU who conduct needs assessment. And one of those needs assessment forums is through annual powwows that take place. And it's a great way to collect data for community partners with them, but also provide a foundation for future collaborative efforts with tribal and urban partners for purposes of grant submissions. There's a whole lot of work going around Alzheimer's disease. And I think it's important to note that according to the Indian Health Service, by 2050, the American Indian and Alaska Native user population of Indian Health Service facilities will increase 7-fold. And with that comes an increased risk for Alzheimer's disease, which is the leading cause of death, or actually 6th leading cause of death in the United States. But there is significant investment in different Alzheimer's disease grants. And I specifically wanted to mention the Alzheimer's Disease Research Center. This is Dr. Deidre Buchwald, who is a sub from University of Washington, where we have a couple of projects. One of them looking at how to promote research participation among American Indians and Alaska Natives in Alzheimer's disease research, because this population is so underrepresented. And so we're really taking a step back and just figuring out under what circumstances do American Indians and Alaska Natives wish to participate in Alzheimer's disease research. Under Dr. Amanda Boyd's leadership, she is in the College of Communications. There's a grant on advancing Alzheimer's disease communication and recruitment science among American Indians and Alaska Natives. There's also the Natives engaged in Alzheimer's research. I will tell you a little bit more about that. A particular project. And there's the Urban Native Elders Urbane Risk and Protective Factors for Alzheimer's and Related Dementias, and that's Dr. Lonnie Nelson. And Dr. Bookwald is the PI for NEAR. In addition, part of it, because there is such underrepresentation of American Indians and Alaska Natives, I mentioned that in one of the Alzheimer's disease research projects, we're looking at barriers and promoters for participation. Well, Dr. Sinclair with the American Heart Association has the Science of Diversity in Clinical Trials. And that is looking at research is ceremony to advance science of diversity in clinical trials and increase enrollment in research among American Indians and Native Hawaiian Pacific Islanders. Of course, COVID is an issue. And there's a surveillance study supported through the National Institute of Minority Health and Health Disparities, which Dr. Sinclair also lead, as well as we do have some support from HERP, as well as PCORI, a newly funded grant with Washington tribes. We are working with primary care practices with the Kalispel tribe, Kama Center Health, as well as Marim Health, which is the Coeur d'Alene tribe. And really what we're doing with this Patient-Centered Outcome Research Institute grant is going to patients who are American Indians and Alaska Natives, as well as providers, and asking them really that it's actually not, it doesn't really qualify as a research project, it's a project. The CORI is very, very clear on, we cannot call it research, but it's engaging a community advisory board of individuals with a history of long COVID, as well as providers who care for individuals with long COVID, to ultimately go through this process to articulate research questions so that it really is driven from the community, from start to beginning, and hearing from, the people who are directly affected by the condition. I also want to note that we have several initiatives that strengthen the education base of future Native scholars, as well as current junior faculty. One is the Native Alzheimer's Disease Research Source Center for Minority Aging Research. Both myself and Dr. Barbosa are alumni of that. And it allows you to get a pilot project that you work on for 2 years in addition to grant instruction on how to become a successful NIH-funded researcher ultimately. And then we also have the nation's first Indigenous developed instructed clinical simulation education center, and that is with Native Health Sciences at WSU. And that is to document, understand, and share the lived Indigenous perspectives, experiences, and approaches in developing this center, and really to serve American Indian students as well as others on how to serve their communities. So we have used this framework, and I think that all these projects, which I have described, they touch on different areas within this foundational applied translational research model. And I would be remiss if I did not mention the Institute for Research and Education to Advance Community Health in this context, because several of the colleges work directly with iReach to support research needs. We have a very, very strong methods core, of which I see a member in the audience, I believe, at least one. But that really can provide the foundation for the scientific rigor that is required for the research. And in addition to Native health, iReach also has an emerging area of Latinx health. And then there's the Northwest Health Education Research Outcomes Network, which is the practice-based research network at WSU. And just to give you a sense of iReach, and it's probably growing at this point, every time we do this slide, we have to update it. 17 faculty and 65 staff engage with diverse community constituents and academic partners in real-world settings to ultimately improve health by focusing on partner strengths. It's population-based and community-based participatory research training. It's the largest WSU research unit in grant funding, with over the past 10 years, 180 million in grant funding, 85 million in current funding, and a large diverse workforce where 35% of the faculty are Native, or the people of the employees. And I would also, when we talk about partnerships, iReach has more than 150 tribal organizational partnerships. But in that spirit also, I do want to talk about the Northwest Heron. And this is the practice-based research network. We are also growing. Unfortunately, Dory Babcock, who is sitting there, who just joined us full-time this month, we do not have her picture on there yet, but she's in the back. And this is our team. It's interdisciplinary. We also have representation from the Department of Sociology. And I think when we talk about external partners, it's important to acknowledge, in addition to Dr. Bender, who has facilitated the introductions to a lot of American Indian primary care practices in the state. Also Ken Roberts and Jeff Bell. And I think it speaks to the type of research that we do. It's community engaged. I remember I had a meeting with Ken a few months ago, Mel, and he said, I asked, well, how much FTE did you spend on building relationships with primary care practices across the state? And in essence, Jeff and Ken, they were 2 full-time FTEs at times, traveling across the state, which laid the foundation for the 200+ network of primary care practices, which now host medical students. And we have, had the honor, because I'd say it's an honor, to build on those relationships and form of research partnerships with some of these sites. Because I think, when we talk about it, it comes down to relationships and managing those relationships. I do want to say that, I'm going to touch on some of the research, but I do think it's important to note that we also integrate students. So I always kind of joke, the R in Northwest Heron is for research, the E is for education. And here you see some of the grants that our students are integrated into, where they help with literature reviews. Some of them have really good qualifications. We have a student right now who is not pictured here, but who is a master level trained biostatistician, and we're giving her lots of work to do. And I think that also speaks to the type of students that the medical school attracts and the opportunity to utilize their skills and for them to utilize them for publications and make them competitive as they apply for residency. But all of these 3 grants have to do with American Indian populations in the state of Washington that they work on. And I think, when we talk about framing our strengths, it's these relationships. And again, acknowledging it builds on relationships that have already been established. The WSU brand is actually, in addition to individual contacts like this, Jeff and Ken and Naomi, the WSU brand carries weight. And when we go and we meet with some who are alumni, that also facilitates work. And so yesterday, Dory and we visited with the Kalispel tribe, actually about 2 different projects. One is this PCORI grant, where they are going to identify patients with a history of long COVID, as well as a provider from their clinic to be part of this community advisory board, which also includes the Coeur d'Alene tribe, as well as other rural clinics in the state of Washington. And they'll convene virtually over 2 years. And in the end, they will have research questions that focus on long COVID from a rural American Indian perspective. We also talked about one of the Alzheimer's disease research grants that we are working on right now. And I think, let me just move forward. Just to formulate how it works, I just want to focus on one impactful area, and that's addressing aging in Indigenous communities, because that's the one that I'm most familiar with. For the other projects that I listed, there are people with much more knowledge about them here. But I think, in what ways do we add value or innovation? I think one that I'm going to address is addressing aging in Indigenous communities, but I also think it's equally important to talk about the approach, and that is the community-based participatory research approach and aspects of it. And that includes involving community members and researchers in all aspects of the research process. And I think that is key when you work with tribal communities. I think it's a necessity. And actually, the National Congress of American Indians has come out with a statement that it's the preferred research method with tribal communities. And recognizing its importance, I'm very glad that I'm at WSU because we actually have an institutional review board that when you work with a tribal entity, it requires a letter of support from a designated tribal authority that approves the study that you're conducting. And I think that is very forward thinking. And when I bring that up with tribal communities that I work with in Maine, oh, they just said, you are light years ahead of the University of Maine. Oh, did I say that? but I think that is a really important tenet. And I think you also have to recognize that each party contributes unique strengths and responsibilities to enhance the health of the community. And ultimately, you hope to combine that with action so that it's not just research results sitting on a shelf. So here are some examples of community-based participatory research and action during a pandemic. And this is one of the national partnerships that I wanted to highlight that we've been working on in terms of aging. It is with the National Indian Council on Aging. There was a window last summer when conferences were open and they held their annual conference, and we partnered with them. Professor Sinclair as well, she was instrumental in developing some of the surveys that we disseminated. And we, came up with a survey that addressed some of their, questions that they were interested in, as what individual investigators were interested in here. And in the end, when we do part of the dissemination of the results, this biostatistician student that I told you about, the one who has the master's level degree, she has run these analyses and put together 2-page reports that we are giving to the National Indian Council on Aging that summarizes the results. And in this process, we're also developing a memorandum of understanding with them. So for their future conferences, we can use this approach. And their next one is going to be in Cherokee, North Carolina in 2023. And Dr. Sinclair, we're going to start meeting with them and figuring out what type of questions we're going to ask, because there are hundreds, if not more than 1,000 American Indian elders who attend. The other beauty of that meeting at that conference is that you can host Washington state specific events. And we did, to raise awareness of WSU, and for some studies specifically survey Washington tribal citizens that we wanted to have specific Washington data about. And they've also introduced us to their board member who is from the Pacific Northwest. So it's an example of national reach, but also very localized reach that can be accomplished through these partnerships. And just to say, one of the projects which the National Indian Council on Aging was a part of, but also citizens of Washington tribes. We have been inviting American Indian Alaska Native elders, tribal leaders, tribal health directors, and American Indian Alaska Native physicians to participate in research studies to offer their opinions on one is, the question I mentioned, what type of Alzheimer's disease research is acceptable to participate in, because the participation rates are so low. How do we adapt an evidence-based Alzheimer's disease detection and management education program to primary care providers who serve American Indians and Alaska Natives? And that will be tested in an RCT. This is the NEAR project that Dr. Buchwald is the PI on. And even just concretely, as a part of this intervention, which is the RCT, how should a dementia brochure aimed at American Indians and Alaska Natives be adapted to this population? And so we've collected data from these stakeholders listed above in bold, 214 of them during the pandemic in different ways, through Zoom, through in-person, and it's been focus groups, surveys, and key informant interviews. And I really wanted to show this. This might not be the biggest grant, but it has great pictures, I think, and a picture tells 1,000 words. And so this is also another example of going from local to national. Here is the adapting the dementia caregiver brochure to an American Indian Alaska Native audience. There's the Dementia Action Collaborative in Washington State, and they have the Dementia Roadmap, a guide for family and care partners. And it does not feature any Native people in the brochure the way that it's created now, none of the quotes are from Native people. And so we had several of the elders and also some of the providers review this brochure and give us feedback on how it should look. And here you see them sitting with the brochure. But basically, you go through section, through section, through section. And in the end, they said, well, you know, we want to see our own people. And we want to see features of our landscape. We want to see activities that we participate in, traditional activities. And we want to hear our people's voices. And here is an example of a quote. And I think it's very powerful. We're going to include it in the brochure. But this is a tribal elder who said, memory plays a very important role in the strength and resilience of our tribal community. The memories of our citizens store the oral traditions of who we were, where we came from, who we are now, and how we should live to continue to survive. Losing these stories and traditions due to Alzheimer's disease is more than losing a life. It is the loss of our history. And ultimately, that is what we're trying to address through these different layered activities, whether it's finding out what does a research protocol look like, which American Indians and Alaska Natives would participate in. How does a training intervention look like for providers who work in IHS tribal or urban facilities? And what about the education materials we give to caregivers? So this is just an example, but it comes back to that. And so I know I'm also supposed to talk a little bit about gaps, and primary topic here, identifying gaps, and what is needed to continue or grow this research. And I think having more Indigenous faculty, including from Washington tribes, I think it's really important as a land grant institution, and they are directly connected to their communities and can voice concerns that other tribal people may not, because they're not from here. And I wouldn't just exclude that to citizens of Washington tribes or other American Indians and Alaska Natives. I think faculty, period, that have worked with tribal communities. I think part of that is also building these tribal partnerships, and it goes back to what Naomi, Ken, and Jeff and others have been doing, spending time on the road and meeting face-to-face with people, because this whole Zoom thing, I mean, I started in November of 2019, and Naomi and I remember that trip we were on when the casino shut down right after we left. Yeah, so it's just, and I think we really need to catch up and actually try to engage more in person, because we have literally been at a distance for so long, and that is essential. And that requires FTE to devote building relationships and partnerships. And those 2.0s that were out and meeting with all the primary care practice sites across the state. And that in turn requires support for Native health research and PBR and infrastructure to accommodate program growth. I also think that we can do more, and actually this came from several of the people who I spoke with and who also sent feedback. We need to raise awareness of the good work that we're doing and add recognition of it across the WSU system. And I think that is, I think that's all I have. And I think, I have, if there are questions or how we continue this conversation.
Great, thank you. That was wonderful. Thank you so much. Let's check in with Anthony over Zoom and see if there's any questions or comments from our Zoom participants.
Right at the moment, I'm not seeing any questions yet. Maybe we can turn to the live audience and return if questions start appearing in the chat box.
That sounds great. Thank you. We'll come back to you. Conversation here in the room. Kaimi.
Hi, Kaimi Sinclair, iReach. I just wanted to also acknowledge that the Dementia Roadmap for Washington and the Dementia Action Collaborative are made up of stakeholders from the Department of Health, Washington Department of Health, and across Washington State. So we've been working Washington Department of Health for the adaptation for the intact project. And I serve on the Dementia Action Collaborative too. So helps all the Alzheimer's work that we're doing.
And she, Dr. Sinclair is also the co-director of iReach. So
Great. Yeah, Daryl.
So great work, and sure glad that Dr. Sinclair is here. So Dr. Johansson, how many clinical affiliations or sites are there with the PBRN Northwestern? How many right now do you have, and how many do you project in the future? What are you hoping for? And is that focused on Indigenous health, or is that broader mission?
well, right now it's focused on rural and tribal health. So it's not just Indigenous health. And like I said, there are over 200 affiliation agreements through the medical school that we build on, and we work with multiple different partners at different times. You know, if you look at, you know, this last study that we just submitted, or no, Project Picori, there are 5 different sites that are involved. And we've had another Empire grant, which has had, you know, we had 7 different sites that were involved, but some of them dropped out. And so it all depends on the scale of the study. I mean, we're looking, we just submitted a large grant that is to the Cooney Foundation as well as Empire Health that would map cancer risk factors in rural Washington and also place medical students to be part of that project. That includes 10 sites. So that is, there are more that have signed on, but I give you those numbers because that's what we're looking at right now in terms of participation of different number of sites.
Patrick, I happen to know you're having a challenge with one of your grants right now in enrolling people, and you've got a pretty wise, captive audience. And I would encourage you to just ask them. No, really.
Oh, which one are you talking about?
Too many challenges. Somewhere you're trying to enroll people into the university system, get access that you and your coordinator emailed me about last week.
I think what you asked me about, Patrick, about the non-WSU students taking.
Oh, I thought you said, I thought you were like sites. Okay,
Oh,
okay.
no.
So this is okay. So this is we actually have a Native American Research Center for Health with tribal partners in Maine, the Wapanaki Public Health District, and faculty at WSU are using their data to develop a public health curriculum. And it's for tribal employees as well as students enrolled at the University of Maine. And we want them to enroll into this Canvas course as non-WSU students. And, you know, we have received the support from the NIH to do everything that we need to do on our end to set up the curriculum, but there seems to be a challenge to for them to actually be able to take the course.
This was a number of years ago, but we pulled it off in the College of Nursing with community partners accessing a Blackboard class. And so they had to set up their own little login, but it's feasible. So let me find out from Connie Myung-Trong in Vancouver how she pulled it off.
Yeah, and I think we are working with instructional designers in Canvas. So
But Canvas and Blackboard are like,
okay,
you know, they're all
right. Okay, so you could do but that would be a really helpful.
Yeah, let me reach out.
I'm looking around the room here to see who's going to be getting the email from us immediately following this, but we will figure this out because that's one of those institutional barriers that are like, come on, we can resolve this. I think you had your hand up, and then we'll go over to Eric.
Yeah, Patrick Jeb Owen from Department of Entomology. First, I just want to thank you for drawing attention to the education piece. I think that's something that's been lacking in the conversation today. There's been plenty of talk about research collaboration, but not as much about requirements for education. And I think that something that's glaringly obvious is that in how we message health research to Indigenous people and how we try to educate Indigenous people, we're bringing a very white Eurocentric mindset and framework to that. And it's important that we think about how we can do that a different way. In our department, for example, we're exploring how we could bring in Indigenous languages to how we teach kids about insects, what they're called, their biology, from the perspective of tribes that interact with those insects historically. That we're not just teaching them their Latin names. So I think it's an interesting thing to keep in mind that we are trying to integrate tribal perspectives and knowledge into how we understand health. We're not just imposing our classical European idea of health research onto Indigenous people. The second thing I wanted to propose as sort of a creative endeavor is I'm aware of a number of Indigenous populations worldwide seeking both through tribal legal channels, so tribal law, as well as their own national law infrastructure, ways to assign personhood to rivers and watersheds as ways to protect those natural resources and to respect how they're interpreted and related to by Indigenous people. And that seems like a really interesting way to intersect with environmental health, thinking about how we understand the environmental change that's occurring around us, the ways it impacts our health, and the way Indigenous people view the environment. There could be really cool creative opportunities.
I was going to say, on the latter note, are you familiar with Dr. Kelsey Leonard?
Yeah.
Yes. So she has been very outspoken or about that, and also written about this particular topic as well.
So first thing is volunteering myself to be put on said email, because we're dealing with a very similar issue with deep vision and getting partners that are well outside the institution access to institutional resources in a way that doesn't involve quasi enrolling them in, as students at WSU. So we can at least be lost together.
Yes.
And I think sort of building off Jeff's comment, one of the things we have talked about a bit of this is workforce development. And I think that's one of the big sort of challenges behind this is as we recruit, Native students and Native faculties and things like that is making sure that when they want to give back to their community, that there's a job there for them. And we were talking more broadly yesterday with the Department of Health, wanting to make sure that, students who come to WSU to study and, help these rural communities can actually go and do that. And I think that's one of the big challenges. And I think one of the things that is coming out of this is continuing to work on that.
Following up just on that, and because we're in a public health symposium, I think addressing that for public health, if we're going to be educating students in a public health or multiple public health degrees, that we make sure that there's a way for them to go out in the workforce.
And also to quote a couple of individuals, just paraphrase what they said from that acknowledgement list. Two people said that Indigenous health should be a pillar of any any public health program here. So that was also noted. Yes.
My name is Linda Becker-Fenter. I'm Assistant Vice President for Federal Engagement and Advocacy for Washington State University System in DC.
Yep.
And you I thought was really interesting in your presentation about getting local tribal members to work for the institution. I'm wondering if we've thought about any kind of workforce programs, or if there are programs that we could think about developing with the federal government to support that pipeline, because it seems like our tribal partners are having issues getting their members to go back to their reservations to work with their communities, let alone come to Washington State University around the state to educate our students and their students. And I'm wondering if there's some kind of, if you have any thoughts about that.
I mean, I think having students, it's more of a long-term process, the way that I approach it, because I'm in education. And so, programs like Nahashne and other programs that engage American Indian students at an early stage and familiarize them with the university. And where there also are opportunities such as, even if they're not, working at WSU, if there are faculty, could they participate in some of our training programs that are available for junior faculty, such as the NADREC-MAR that I just mentioned. And so I think it's a long-term process, and it does require input from the tribal communities about how that would go. But where I have seen it at land-grant universities, I was at the University of Nebraska for many years, but we did not have many local tribal faculty, and I think part of it was we did not have many people who went through the pipeline. And you would see that from other communities where they went through the pipeline and then they actually came and stayed in that particular university. So I think it would behoove us to look at what are successful at other land-grant institutions. Maybe Oklahoma has some. Yeah. Yes.
So I know the National Science Foundation has specific programs to try and involve Native American students into STEM fields. And it's not necessarily to become part of the institution, but to just integrate in STEM, but with the understanding of bringing traditional ecological knowledge or traditional knowledge streams in side by side with Western knowledge streams. And so there's the RAMP post-bac program that we submitted a proposal for last year down in Pullman with the University of Idaho. And we worked closely with Native American Relations Office to do that. And we got rejected, but we're resubmitting, but it seems like this is like one of the things that we want to promote is for these students to bring back, their knowledge to their tribes, and hopefully in the long term, unite and bring side by side, their interests as well as Western interests in terms of how they think about problems or how we think about problems. So just bring that integration. Is that something that can be looked at in other areas of the WSU system to apply to that kind of a program? I know NSF isn't in line with a lot of NIH or other kinds of programs, but.
Well, I think there's somebody who knows more about that in this room than I do, and I'm looking at Native American health sciences. Dr. Naomi Bender.
There's a lot of programs at WSU. I mean, our office alone, in collaboration with the colleges of nursing, medicine, and pharmacy, have 13 Native pathways. And the goal isn't to necessarily have students matriculate and really lean in towards Western understandings. I mean, we provide the space and the time and support, but as far as I'm concerned, it's our job to be inclusive of Indigenous perspectives while we are creating those programs and training that includes the inclusivity of community at the center of each of our programs, not WSU community, Indigenous community. And what those students decide to do, if they decide to go back to their people, I think the assumption is that let's train them and then they'll go back to their people. Native communities, we want to grow our own, but we also have the understanding and realization that each Native student's pathway is unique, and that oftentimes they'll choose to go serve other communities, build confidence, build layers of understanding in both Western, modern, and Indigenous perspectives before they come back to their people. And so I would say that we need to kind of find a way to filter and diminish some of those quick assumptions about what we think we need to be doing, and try to come from more of a perspective of community. Currently speaking, we have I'll give you an example. We have one Native student who's been through 3 of our summer programs as a high school student, as a Rise Academy summer student with the College of Medicine in my office, and just matriculated into the WISE postbac program. And should she enroll in the College of Medicine this next year, she will be her first tribe's physician ever in the history of their people. And it is a Spokane tribal member. And it's those kinds of programs that we build when we do it together. We do it with community, with their advisement about what to include, that can help contribute to that. But it's not to say that she would go back right away and serve her people, right? I mean, eventually students decide where they want to go. And having done this work for almost 20 years, I actually see more Native students go and serve other tribal communities in other urban and other rural areas before they go back and serve. I'm not saying that's all or the majority, but it's very common practice. And I'm seeing a lot more institutions realize that we have to stop thinking of it like we need to fix the problem, and that we need to do it alongside our tribal partners and have them help us build these programs and understand how to do that together. So that's just sort of my answer to that.
Oh, and I think it's important to remember too, that 75% of American Indians live in urban settings. So, you know, because of colonization, not everybody has a tribe to go back to anymore. And it's hard to go back to your tribe anyway, because some of the things I can't remember, somebody talked about, you know, oh, this is a Pacific Islander. But you know, when you go back to communities like a small town and, you know, they think you come back with all this knowledge and you're a big shot and stuff, and they pull you down. And so some people can't go back. And so, you know, we need to work with communities too, so that they support their community members to come back. And, you know, I think a lot of Native people want to do something for their community, especially in the communities where they grow up and, you know, see a lot of inequity. And I do grants for the training workforce development for NIGMS, and they are to get underrepresented minorities into biomedical research careers. And it's always a struggle. You know, the ones that do recruit American Indians always have a difficult time getting the recruitment because people can't necessarily leave the reservation to go away to four-year college to even get a bachelor's degree because maybe they already have children, or there are other issues, they got to take care of family and things like that. So it's really difficult. And so, you know, that pipeline is broken. There's no pipeline sometimes for people. And so making partnerships, I think tribal colleges can be really helpful. And that's kind of, for some people, the first place that they're going to go after high school to a tribal college. And if you can better support tribal colleges to prepare students to get to a four-year college, that can be. And most of the mentoring that we do at iReach is really at the PhD level and do PhDs and helping people learn how to write grants, papers, and become independent investigators. But we do have a lot of students that join us because of the STEM, a lot of master's students doing capstones and internships and things like that, and even undergraduates. And that's the work with Native Hawaiians and Islanders. And there are even fewer Native Hawaiians and Pacific Islanders out there. Lots of work to be done. Be creative for the
And actually, on that note about tribal colleges and universities and partnering with them, that also came through in some of my meeting with the folks that were listed in the acknowledgements as well, and was echoed as a way to promote representation.
Yeah, I had a quick question, but I know it's not a quick answer. But in your work with the, especially local communities, and with the participatory approach, have you identified, or like with the communities, what are the priorities in terms of like health problems they would like to address?
We did a survey, and this isn't just with American Indian serving primary care practices, but we've surveyed sequentially before the pandemic and during the pandemic, and across, you know, the sites, number one was behavioral health substance use. And then before the pandemic, after that was, you know, chronic disease, cancer, diabetes, heart disease, etc. When we did it during the pandemic, number one was still behavioral health and substance use, and then COVID, number two. And then the third was the chronic diseases.
Thank you. Can we kick it over to Anthony one last time over Zoom? Any questions or comments?
I think we covered all our questions in-house today, so not on Zoom.
Great. Thank you so much. Thank you, Anthony. Thank you so much, Patrick. That was fantastic. I'm very mindful of the time. I know folks need to get back to Pullman to pick up kids from daycare and things like that. I'm sure there's folks that need to catch some flights too out of Spokane. I want to thank everyone for their time today. John Roll called it in our steering committee. He said, we will not have time for that group discussion at the end. You are absolutely right. I do want to say just a couple of quick things here. We met 3 of the 4 goals. The goals were to identify our strengths in public health research, to identify gaps, collaborations needed. The last piece we're going to do over Qualtrics. So we will create, the steering committee doesn't know this yet, I don't think, but we're going to create a Qualtrics survey. It'll go out in the next few weeks to every participant here in person and over Zoom, everyone that registered. And we are going to look at ways to more effectively engage with the WSU Public Health Collaborative. Vice President Chris Keene had to leave early. I did have lunch with him though. And he's really hopeful in utilizing this group here and the steering committee moving forward to build out and formalize the public health research, that wedge in the Office of Research's wheel of our research expertise across WSU. So we'll continue to think of ways to formalize this, and we need infrastructure, right? So that's also going to be a key part of what we focus on. We are going to also think through how to continue this. Do we do another one of these? Do we focus on our external partners? This is really a large internal symposium. Do we need to do this externally now? Do we need to pick 6 more topics to focus on a year from now? Things like that. If you want to participate, please stay tuned from email opportunities that you will be getting from our group. I want to thank Vice Presidents DeWald, Keene, and Kerr for their ongoing leadership here and for their sponsorship of today's symposium. Patty Stoffer, who really pulled this whole day off. So thank you, Patty, very much. Rainbow the cats that are known as the steering committee members. That's Erica Austin, Janessa Graves, Laura Greiner Hill, Tom Kula, Eric Lofgren, Vicki McCracken, Courtney Meehan, Melanie Angela Nui, Guy Palmer, John Roll, Alyssa Schwartz, Jennifer Sherman, Sammy Rodriguez Fletcher, Elizabeth Waybright, and Paul Whitney. So thank you for the steering committee for all of the work that went into today. I also want to thank today's speakers. Thank you so much. We are truly indebted. I get to hear a lot about this research through my job, and I still sat in awe in every presentation hearing what is going on. I am truly indebted, and I'm sure you'll call in that favor for sometime this year, I'm sure. Also, thank you to the Zoom moderators, our Zoom attendees, as well as all of you in the room today. Please look out, like I said, for emails with how to get involved with our public health collaborative as we continue to grow and formalize this. Thank you all for your time, and go Cougs. Thanks.